All right, thank you. District 2 Representative Kathy Miller, would you lead us in the Pledge of Allegiance? Thank you. For the record, this is the regular board meeting of August 24th, 2021. Morning items will be heard after consent calendar and followed by discussion items. Madam Clerk, roll call, please.
Supervisor Miller?
Here.
Supervisor Nguyen?
Here.
Supervisor Villapudua?
Present.
Supervisor Rickman?
Here.
And Chairman Patty.
Yes, thank you. Now is the time for public comments on matters within the jurisdiction of the Board of Supervisors that are not listed on the agenda and minutes, appointments, consent, calendar, and closed session. We request that you fill out a comment form if you address the board in person. If there's anyone in the audience that would like to address the board, there's a time limit of 3 minutes for these comments. There's a device on the podium with a green, yellow, and red light. At the end of 3 minutes. With regard to public comment, the law strictly limits the ability of board members to discuss matters not on the agenda, so this is not an appropriate time to have a discussion with the board regarding your comments. We ask that you refrain from personal attacks during your comments, although that's not oftentimes adhered to. But we would like that you address all comments to the Board of Supervisors, not to the audience. Comments from the public may not reflect the viewpoint of the Board of Supervisors. Madam Clerk, do we have any public comments that have been submitted?
Thank you, Chairman. We do have one person here to speak today, and I have 2 items to read this morning. Would you like me to read those first?
Please.
Okay. This first comment was received at 7:45 p.m. on August 10th for the August 10th meeting. However, since it was after the meeting, I'm going to read it now. And it was submitted by Deborah Matura regarding the Embarcadero West housing crisis. And they write, "This building has been deemed unsafe by the HOA. Instead of red tagging it unsafe, the HOA has slapped a $90,000 bill on each homeowner payable in 45 days. I am legally disabled and can barely cover my living expenses. The HOA is also threatening liens for non-payers. I cannot even qualify for a loan for this, nor can I sell my condo, as one will buy under these disclosures. I am trapped and in danger of becoming homeless. Please help. Please, we only have until September 15th, 2021. Deborah Matura." The next comment is submitted by Ruben Rodriguez, who writes, "Dear members of the Board of Supervisors, for several years we have experienced staffing shortages which have caused major issues of burnout. We continually fill minimum staffing requirements with voluntary and mandatory overtime. It has been a constant state of emergency where we fall below minimum staffing. That, combined with the increase of inmate violence and sophistication, causes a great risk liability for officers, support staff, inmates, and the community at large. There are plenty of statistics that show how negative the impact is to officers and their families under these circumstances. It is a regular occurrence for our correctional officers to be ordered to work 14, 16, and 18 hours a shift in the unpredictable nature of the custody setting. We still have over 30 vacancies after hiring fast and furious with bonuses and an entry age of 18 years. We are not competitive enough to attract and retain viable, qualified, and resilient staff. The wage disparity between correctional officers and deputy sheriffs is so large that a top step deputy earns more than a top step correctional sergeant. The sheriff and his staff have worked hard to alleviate the problems within their power. We need you to authorize a fair increase to our wages for those who walk the toughest beat in San Joaquin County. Thank you for your time and consideration. Please feel free to contact me with any questions, comments, or concerns you may have. Ruben, President, SJCCOA." And Chairman, that concludes the public comments. I do have comments later for the COVID-19 discussion and people here to speak in person.
Very well. I have a request by Ms. Patricia Barrett to come forward for public comment. Ms. Barrett, please drop the microphone so we could hear you. The microphone right in front of you. Just tilt it down. Yep.
Chairman, I believe we need to turn it on real quick, and that should help.
Can you hear me now?
Gotcha. Loud and clear.
Good morning, everyone. Isn't this Bay Area weather great? One more thing that the homeless, the unsheltered homeless don't have to worry about. Not here for the homeless this time. As a resident of District 1, the most underserved infrastructured district of all this county, I am here to ask for the support in implementing more COVID testing areas. Last week, I was at a conference in Sacramento, and as a fully vaccinated, recommended guidelines follower, team player, I was exposed to someone that is fully vaccinated, also following guidelines with COVID. I, after the conference, came home, which was at the end of the day, we found us out. And I dropped off another participant, and I went to Edison. That's my testing area. I thought these people were in line to pick up their kids. And so I asked, are you here to get your kids? They said, no, we're here for the COVID testing. What? We're down the street by the SPCA. I'm like, wait a minute, what happened? So with this new variant, I guess everybody's kind of like worried about it, and even just, okay. But for us to have to get in line, we have Franklin, we have Dorothy Jones, and we have Edison. And we have population, Supervisor Villapoudois, 10,000 that are underserved, don't have the vehicles. Mom and dad work. Grandma and grandpa are stuck at home. They have to come, pick them up, get them tested after hours. Guess what? They're not open. Okay? So we're stuck in a rut right here on South Side. And I'm asking you, I'm going to go to the city tonight, and I'm going to ask them the same question. Can we get more COVID stations? I spent almost an hour in an area that already has bad air, right, with 10 years less life expectancy than the north side with asthmatic and COVID borderline, running my engine. We need more stations. And all I'm asking you is helping the city, which is under your roof, one of those rooms, and helping them and work with them to let's get some more stations put down on the south side. On the weekend, somewhere in the evening, CMC will do it. UOP will do it. Little Manila will offer spaces. There are places. We just need to get the county community centers. That's me. But this is what I'm asking you. I'm going to go, and I'm glad to see all you guys again.
Thank you, Ms. Barrett.
Coming back on the schedule in 2 weeks, you said? I'll be back.
Thank you. Next, I have a request from Ms. Kaylee Mahoney.
Good morning. I have both my kids this morning. 2 weeks ago, I came here advocating for my son, Desmond, at TCK. I had to pull him the next day because I was being told they're waving at you. Sorry. I had to pull him the next day because I was told by his teacher that we are wrong for fighting for mask choice. So I now have teachers in our Lincoln Unified School District that are telling my children that I'm wrong for fighting for our kids, for something that is literally not based on science. But I'm here again today to fight for, amid the new FDA pass of the Pfizer vaccine being FDA approved. And I want to ask some questions, and I know Maggie Parks is somewhere. I'm not sure if she's in this room, but I'm not saying this to call her out, but it's for all of you to take this into account. Has Pfizer ever been found guilty of using children in life-changing medical experimentation without their knowledge or consent of their parents? The answer is yes. Has Pfizer ever lied to regulators about the safety of their products? The answer is yes. Has Pfizer ever been found guilty in a court of law for scientific fraud? The answer is yes. Has Pfizer ever been found guilty of bribing doctors? The answer is yes. Has Pfizer ever been found guilty by a jury of racketeering fraud? The answer is yes. Has Pfizer ever been found guilty of breaking international law according to the Nuremberg Code for unlawfully experimentation on human subjects? The answer is shockingly yes. That vaccine was just FDA approved. You know what else is FDA approved? Cigarettes. Do we all just go smoke them now? We don't. My son knows. This is about freedom of choice and health. I'm not going to demonize you for choosing to have the vaccine, but please do not force it on people. This is something that is so corrupt and so wrong, and I really implore you guys to not vote on mandating vaccine passports in our community. I'm still fighting for mask choice. I am absolutely still fighting for that, but if we don't fight for mask choice, and we can't win that fight, we absolutely will not win for vaccine passports and mandating that. Desmond, do you want to say anything? They can hear you.
So, everyone will not listen to Gavin Newsom, probably, and no one is gonna listen to him, hopefully, and I hope everyone will listen to Jesus.
Thank you.
Thank you, Desmond, and thank Ms. Mahoney. Any other people present or any last-minute submissions from the county clerk online?
No, Chairman.
Okay, thank you. Seeing none, we'll move on then. There are no minutes to approve on this date, and we are without appointments for approval from our vice chair. At this time, we will call upon Dr. Park to discuss and receive updates on COVID-19, San Joaquin County, and get updates from Mr. Dietrich as well. Thank you.
Morning, Chair and Supervisors. Ada Wilverding. So on the left side is the usual epi curve for all cases to date, and I bring this to you to show you how we are just below the max peak point that we had achieved back in summer of 2020, when we had over 400 cases on a couple of days. We're almost there. We are still going up. You might see that the bars on the right side of the blue look lower, but those will be added onto in the coming days as our EPIs receive more case counts. And we do expect that those bars will go up and that we will probably hit the same peak as summertime, perhaps higher. And then just out of interest, we are showing you the curve for the 0 to 17-year-old population to show you how they're peaking as well. So you can see when you look at the blue bars, most recently, we're getting about 350, almost 400 cases a day on some days of positive reports. And of those, maybe 80 to 100 are in children 0 to 17. Our case rate is now 34.8 per 100,000 with a countywide test positivity of 8.5. And in our lowest quartile, we have a test positivity that's quite high at 10.6%. We have 251 people hospitalized with COVID right now across our hospitals, 65 of them in ICUs. I think about 50 of those, 50 were on vents yesterday, with an ICU capacity of now 118%. Just want to show you some of the most recent state public health orders that have come out because there's been some confusion with businesses calling, preschools calling, thinking that they need to vaccinate their workers or test them. These are the only orders that have come out. So on July 26th, there was an order for healthcare worker protections, asking people to, if not vaccinated, to have that verification of the vaccination status of workers, and for those who are unvaccinated, undergo weekly testing. There is vaccination requirements for healthcare workers, as you could see on August 5, that came out, and then most recently, not just for healthcare workers in hospitals, SNFs, and intermediate care facilities as what came out on August 5th, but adding to that on August 19th was healthcare workers in correctional facilities and detention centers. Schools on August 11th were asked to check verification of vaccine status of school workers and do testing regularly for those who are unvaccinated. But it is not a vaccine mandate in that situation. Other new things that have come out from the CDPH is updated quarantine guidance, which basically is updated to match the current science and what the CDC is recommending, and that is that quarantines of 14 days can be shortened under certain circumstances. The standard is still 14, but for unvaccinated people, quarantine can end after day 10. It can even end after day 7, so on day 8, if a test done after day 5 returns negative. In vaccinated people, an asymptomatic exposed person who is fully vaccinated does not have to quarantine, but should get tested. So we used to say that fully vaccinated people who were asymptomatic and became exposed as close contacts didn't have to quarantine or test, but now the recommendation is to test. at 3 to 5 days after exposure. For both groups, all people are asked to continue to self-monitor themselves for symptoms through the duration of 14 days and follow all non-pharmaceutical interventions such as the masking, the distancing, the hand washing, so on and so forth. And of course, if any symptoms develop, the recommendation is to immediately isolate, get tested, and see your doctor. Also new from the CDPH on August 18th was an adjustment to the Beyond the Blueprint guidance for industry and businesses. As you might recall, the definition of mega events had been crowds greater than 5,000 indoors and 10,000 outdoors. We are now saying that we need to be extra careful because of the Delta variant, and we're going to make a mega event a definition of 1,000 people. So same rules apply where indoor mega events should either have documentation of a negative test or documentation of vaccination for entry. This also has been updated to remove the self-attestation for indoor mega events. No longer can someone self-attest. Somebody really has to be checking to make sure that they have a vaccine or that they have a negative test. The rest of the rules still apply. This goes into effect on September 20 and will remain in effect until November 1 at least. Our vaccination progress is still moving along. We have now administered 737,000 doses into arms. As you know, we have a population of about 783,000 people in this county. Little shy of 600,000 for people 12 and above. Each of those doses, each dose is counted. So one person who received 2 doses of an mRNA would count for 2 in that number, 737,000, which is why you can understand that we're about 65% vaccinated for the eligible population. It would seem like we were almost completely vaccinated, but those are the number of doses administered, not the number of people administered. So for the number of people administered, 52% of our population is fully vaccinated, 13% partially vaccinated, so a total of 65.4% with at least 1 dose. So speaking of vaccinations, of course, we know that a recommendation came out on August 12th from the FDA. The CDC in the Western states then approved this the following day, August 13th. And so around that time, CDPH did say that we could start vaccinating people with 3rd additional doses if they had a qualifying immunocompromised condition, which are listed here. This is 12 and up for Pfizer, 18 and up for Moderna, people who have had active cancer or tumors or cancers of the blood, anyone who has received an organ transplant, taking immunosuppressive medications, stem cell transplant, moderate or severe primary immunodeficiency such as DiGeorge or Wiskott-Aldrich, advanced or untreated HIV, and anyone with active treatment upon high-dose corticosteroids. So this is now happening across the state where people can receive a 3rd additional dose. This is different from the news about boosters coming from the Biden administration and Health and Human Services, which will start on September 20th, supposedly. This is not considered a booster. This is considered a 3rd dose because studies showed that in immunocompromised people with these conditions, they perhaps had mounted some immunity to COVID-19 after 2 doses, but not as much as others who don't have immune-compromising conditions. And so studies showed that a 3rd dose could get them to that 95% that the rest of us are enjoying. Therefore, this is not a booster, it's an additional 3rd dose. Boosters are really defined as being given to people because your vaccination is starting to wane as far as effectiveness and immunity, and so we get boosters when they start to wane. So the boosters for the general public, and a statement made by the HHS said that recognizing that many vaccines are associated with a reduction in protection over time, and acknowledging that additional doses could be needed, we've been analyzing the scientific data closely, and available data make it clear that protection against SARS-CoV-2 begins to decrease over time following the initial doses. And in association with the dominance of the Delta variant, we are starting to see evidence of reduced protection against mild and moderate disease. So based on their latest assessment, they do believe that the vaccines are protective against severe disease, hospitalization, and death, but the fear is that this might diminish over the coming months. And so the expectation is that we will be offering booster shots to people who were the first recipients, and in that order go for anyone who's been 8 months past their initial series. In other news, yesterday, Pfizer received its full biological licensing approval. So this is the statement from our state health officer, Dr. Tomas Aragon. So not to belabor this, but just going over the latest news of what's been happening. So again, this, we are hopeful we'll get some more people to accept the vaccination now that there is not an EUA for this particular vaccine. And of course, there's talk about this allowing for further mandates of vaccinations. So our mobile vaccine unit continues to vaccinate on average 5 days a week, and we continue to put our schedule up on SJ Ready, San Joaquin County Public Health Services, and on our social media sites. Postcard is going out to 46,000 people in English and about 15,000 people in Spanish this week. And of course, with the Delta variant and people getting sick and kids having exposure events at schools, with schools open, we are seeing an increased demand for testing. So as a reminder to folks who are looking for testing sites, we know for sure that the ones that we have endorsed and are legitimate are on sjready.org, again, SJCPHS, and we also put them on our social media. These are the fixed testing sites as they are right now. Most of these are run by a private vendor called HR Support. The former Joe Cerna Elementary site and San Joaquin General Clinic site are state-sponsored sites run by a company called OptumServe. We have been in talk with the state to see if we could increase those days, and San Joaquin General Clinics have been open Tuesdays and Thursdays 7 to 3, and we were able to get those hours expanded to 7 to 7. And then the Joe Cerna Elementary site had been open Tuesdays, Wednesdays, Thursdays, but you see the asterisk next to the Monday and Friday. We did petition to the state, and they're adding back the Monday and Friday opening dates effective next week, August 27th. We are working to try to partner with HR Support and with perhaps other testing vendors to try to increase locations and times and be available throughout more parts of the county, as we know that this is mostly Stockton-based sites. We do have the West Valley Mall in Tracy, but there's a high demand there. There is a request to go back to the Manteca Transit Center, which HR Support had been at before. We have requested that they go back there. We had a Verily state van 2 days a week in Escalon at the community center. We are asking them to go back there and perhaps back to the Eastland Plaza. So looking at a lot of options. But when you look at all of these dates, days and times, we're talking about PCR tests. And most of all, these PCR tests are getting a pretty good turnaround time. I'm hearing 24 hours in most cases at these sites. So I want to go through the various testing options that do exist. And as I said, most of our test sites, or all of them that are on the slide that I just showed you, are polymerase chain reaction tests, PCR tests. This is a type of NAT test, also known as molecular test, which detect viral RNA fragments. This is considered the gold standard and the mainstay for diagnosing COVID-19. It's very highly sensitive, which means it's unlikely to return a false negative, and it's highly specific. So when we have other tests that might not have correct results, this is used as a confirmatory test or as a standalone test, and the one that we've been using for the most part. There are folks doing rapid antigen tests around the county. I wouldn't be able to build a list of who they all are because they are not reporting to us and they're not reporting to the state's CalReady system. I do know that there are urgent cares that do offer rapid antigen tests. These are not vetted through us, and unfortunately, without them reporting to the state's CalReady system, we don't have a complete list of everyone doing them. It's just through anecdotes and hearsay and knowing people who have gone to those sites that we know they're out there. An advantage of the rapid antigen tests are that you get the results very quickly, so point of care use, perhaps 15 minutes, meaning that somebody who's symptomatic and gets a test, who's been exposed, could know right away, confirm that they're positive. In that case, the rapid antigen test is very useful because it's pretty good at finding positives. And with the Delta variant having a very high viral load, these antigen tests are supposedly doing well at finding people with the Delta variant because their high viral loads in their nostrils are really turning up positive on these tests. So that's the great part, is we can tell you you're positive and get you to isolate right away before you infect others. The drawbacks to rapid antigen tests, as I've discussed before, is that they're really not made and marketed to be used in asymptomatic people. They have a lower sensitivity, which means they do have false negatives, and a negative test does not necessarily exclude infection. So in somebody who is symptomatic and has maybe even a history of exposure, we call that a high pretest probability, meaning they have a high pretest probability of being positive. Yet if they're negative on a rapid antigen, that could be falsely negative, and we do like to follow that up immediately with a PCR. A PCR should be done on anyone in that situation. Also, if you are not exposed but you have symptoms of COVID-19 and you have a negative antigen test, that really should be followed up with a PCR. And another recommendation is that even positive results should be confirmed with a PCR. There are false positives because this is a very reader-dependent system. You have to look at a card which looks like a pregnancy test, and you have to be trained in it, and you have to be consistently doing it to make sure that you're not over-reading the card. So these rapid antigen tests are really most reliable when used on symptomatic people in areas of high prevalence of disease. So we do allow them to be used for screening of people in outbreak situations, for example, but for the most part, they're made for asymptomatics. They can be very useful, though, in a situation like now where we obviously have high prevalence of disease in our community, and there are a lot of people who are needing testing because they've been exposed. So lastly, there's serological tests, which some people misunderstand these antibody tests as telling them that they are infected. It should not be used to diagnose an acute infection. Antibody tests tell you that you've built some immunity to perhaps COVID-19 in the past from previous infection or from vaccination. You tend to build your antibodies a couple of weeks after the event, so they cannot tell you about an acute infection, so they cannot be used to diagnose current infection. They should also not be used to infer immunity. There are different types of antibody tests out there. These are basically tests for immunoglobulin levels called IgA, IgG, and IgM. Your IgG is the one that tends to stand around for a while, and so that might be tested in some of these commercial antibody tests. Some of these commercial antibody tests test for the nucleocapsid protein, some for the spike protein, some for both. And really you need to know what you're looking for, whether you're looking for an immune status after vaccination or after having had COVID, to know you're getting the right test. And then another problem with this is that you could have a positive level with some number assigned to your IgG level, but you don't know if that level really means that you have developed immunity. We don't know at this point. We don't know enough to know what level really confers immunity and how long that would last. So on the left side is a table from CDPH that really goes into the serological antibody test. And uses are really right now for prevalence studies, epidemiologic studies. maybe to identify convalescent plasma donors, maybe when you have someone who you think was missed during the time that they could have tested positive on a rapid or a PCR, but yet they're developing symptoms like a long COVID, and you might want to use an antibody test, but not to determine COVID-19 immunity. And the CDC says the same thing. It's not currently known whether positive antibody test results indicates immunity. Therefore, they should not be used to determine an individual is immune against reinfection. And the IDSA says the same thing, that there's currently not enough data to support the use of serologic testing for determining protection against primary or reinfection. And the reason why I bring this to you all is because I know that there are some places offering this right now around our county, and I'm hoping that the public understands that this is really something that you might walk away from thinking that you have immunity, but you have to be careful because we don't really know what it means when you receive this result. And it doesn't mean that you don't need the vaccine. It doesn't mean you can do away with your masks and do away with your hand washing. You need to keep up with all of those things because this is not going to tell you enough from getting one of these tests. So I really want to caution the public. Okay, now speaking of the rapid antigen test, this is what we have available in the county through our emergency medical services agency, because they're the medical health operational agency for the county, and this is available through the state. Don't know when the state's cash is going to run out, but these are called Binax Now rapid antigen test cards, and they come in a box just like is shown in this picture with 1 bottle of solution and 40 of those cards and 40 swabs. A person will stick the swab in their nostril, left side, then right side, put 6 drops of the solution in that upper little circle, stick the Q-tip through the larger circle, swirl it around 3 times, close it with the sticker on the side, and then wait to see for 15 minutes if a line shows up. The control line should be there, or it's not a good sample, it's not a good run. But then under this, on the sample line, if there's an extra pink line, it's positive. A faint pink line might be overread as positive. Those are your false positives. And sometimes people will read a really light line as positive. You have to make sure it's a dark pink line that goes from edge to edge. So as I said, a little bit reader dependent. I will tell you that we are going to start doing this in the county because it can be used as a tool. And so we do have San Joaquin County clinics, Joan Sing Song's teams mobilizing, starting this week, in fact, to do testing using both types of tests, so that her team will have both rapid antigen tests with the Binax Nows available, and the PCR. And we really want people to try to get the PCR gold standard, but the Binax Now is available. However, if you have a history of exposure, you have to get a PCR. And if you have symptoms, we really want you to get the PCR. But the Binax Now is also going to be available for you to have your results in a more speedy time frame. So very thankful to Mr. Culberson and Dr. Fadu and Alice Celine, who manage the San Joaquin County clinics, for mobilizing this team and setting up these test dates. So we will put these dates and locations up on those websites as well and on social media. So what I want to say is that in addition to that, we have some other options. This is a Fulgent kiosk. So if we have a lot of fervor to really expand, we can work with other companies who might be able to also set up test sites throughout the county. So I'm bringing to you a couple of ideas from my research. This can be a kiosk, this can be a drive-through. This is the same company that we bought home PCR tests from. They do rapid PCR tests, which result within 24 hours most of the time, sometimes 48. But they can stand up sites in the county with some assistance from us, but they have the kiosk manned with clinic staff, their own staff, and they have the ability to do the tests, send them back to their own lab, and get results out to people. And I know from having worked with Fulgent that these results do come to CalReady, that it's totally legitimate, gets counted, and and the reason why that's so important, is that we need to be able to contact trace people. In the past, I thought it was very important that all results went to CalReady because we wanted them counted to get to that state median. But in addition to that, really, you need them to be put into the state system so we know who's out there, we know what our real case rate is, and we're able to contact, trace, and isolate people. They are able to offer coronavirus testing as well as flu testing. This is mostly at no cost to the county, but the county would be the payer of last resort. In other words, they would bill a person's insurance, or non-insured people, they would bill HRSA. But about 2 to 5% of the time, from their experience working in LA County, Fresno, Orange County, about 2 to 5% of the time, they say consistently they're not able to bill or they don't regain. And for those cases, they would want the county to pay $55 per test. The other thing is that we do have the HR support vendor in town already at all those test sites that I showed you, mostly at our Stockton Unified Schools, at the West Valley Mall, at Delta College, and as I said, we're trying to put them in Escalon and Manteca. We've reached out to them. If we are able to get them Binax Now boxes, such as the one I showed you, they would possibly be willing to administer that test in addition to the PCR test they're doing, but at a cost for the labor. So, if you want me to bring these items back to you or further discuss it, we can. At this time, I'm waiting for CDPH to reply to me. What we're trying to find out is if HR support offers a Binax Now rapid test, and we pay them to do that, and we give them the Binax Nows, but they do the PCR, and the PCR goes to Avellino Labs and then gets to CalReady, do they also need to report the Binax Now? The reporting part is a difficult part. There is a Navica app that the Abbott company has designed that supposedly makes it easier, but still it adds to their labor. If we were to say that they would concomitantly do both, a rapid and a PCR on everyone, would it be sufficient to say that all their PCRs are getting reported to CalReady? I'm researching that right now with the state. But in the meantime, they've given their price of $10 per test. And that's the lowest. I asked them to give me their best price, so $10. And that's before me telling them that they might need to enter all results into CalReady or the Navica app or through a CSV file to our EPIs. So I don't know if that price might go up if we say, we also need you to enter these because it's the law to be reporting all of these results. My understanding is that with Binax Now rapid antigen test, the very minimum for the state is that you have to report your positives. So I still have not heard back from the state, but that's where we stand at this point with those options. That was really the end of my presentation. I don't have any other slides after that. Thank you.
Thank you, Dr. Park. Couple questions before we bring it to the board. The efforts, when would the efforts take place for us getting out the antigen testing at our current sites, and how many additional sites are we looking at? And the reason why I ask is my office and others on the board here have seen these pop-up testing sites, in particular one on Pacific Avenue, Sherwood Mall, and there's lines of 100 plus people any given time standing patiently looking to just get results, find out and get answers. And I would imagine the benefit would be when you're engaging and somebody has the symptoms, whether it be fever, and I know some of the symptoms with Delta is a bit more severe than prior. So that engagement while testing could be quite helpful, especially when it's done in a highly visible, like Pacific Avenue. You've got thousands of cars an hour pretty much going up and down that road. So what would we be doing? I know that we have a list here, but what would we be doing to increase our footprint and the engagement for this type of testing?
So I believe we could act quite rapidly when you're talking about expanding HR support and paying them $10 to do each Binax Now on top of the PCR they're already doing and sending to their Avellino lab. We have a supply of Binax Now here in the county, and we can get more through the MOAC process. As I said, now there's many counties looking at Binax Nows, and although the state has a healthy supply, I don't know when that's going to run out. But we have the supply of the actual boxes. Now we would need to quickly turn around and create a contract with HR support to do this, and we would need the purchasing order to go through quickly. And we would need to make sure that they're trained on whatever they need to be trained on, whether it's entering a CSV file with all the positive results or whether entering into Abbott's Navica app. So a little bit of training might have to happen, and they'd have to be willing to do that if the state says they have to. But if they are willing and we are willing to pay them, we could turn this around rather quickly, I would say by next week even. It's available, and it's very simple. It's a very simple test to run. In fact, people believe that a PCR test is much easier than a rapid because the rapid you have to sit there, put the person's name on the card, line them up, and wait for 15 minutes, whereas a PCR, you just swab the nose, stick it in a tube of juice, and off they go. But I understand that the result coming back faster is sometimes desirable.
Sure.
I think it can be quick.
To that point, back almost a year ago, back in November, when I had gotten COVID, I went to the county hospital and I was able to be informed. Actually, it was just a lucky day. It worked out. Within an hour, I got a phone call telling me I was positive, even though I had no symptoms at all, which kept me from going to a Christmas party that evening and being perhaps a guy that was going to be a super spreader. So I went home and isolated, and several days later, the symptoms really took hold. So what is it that we could do to increase so that we are being, and I know that would depend on the hardware we might have available and the purchase of that equipment or the availability of staff and such. But what could we do if the PCR is more accurate? What could we do so that we are ahead of that 24, 48 hours, 72 hours? Some people last year were taking 5 to 7 days before they were getting notified. What is it, and by the way, Dr. Park, I truly appreciate this extra effort, and I'll ask CAO Wilverdeen in a moment about where we're going with this. But I appreciate the extra effort of engagement that we have, because we're always looking for what more can we do. And so here we are with some solutions. And certainly you're working with Mr. Dietrich and so on. But back to my question, what could we do to have a more rapid response with the PCR?
So, yeah, and thank you. I appreciate that. And we really were motivated by Supervisor Miller to take on this mission. I appreciate that, knowing that the constituents are wanting to have more rapid testing. So I did hear that loud and clear from her office. And so what can we do to get the PCRs quicker? We are already experiencing very quick turnaround times with HR support. I don't know if they can be any quicker. I have many people who have gone to one of the high school sites at 5, 6 p.m. and get their results at 4 a.m. the next day. So the turnaround time is actually quite good. It might start to slow down as their lab gets busier and busier, but so far I'm still hearing that the turnaround times are good. I don't think you can get much better. Even the tests that come directly to our lab here in Stockton at Public Health, the best turnaround time you could get is to give it to us in the morning and have it run and result it out by the afternoon. But really to get it in 12 hours, less than 24 hours, 12 hours, it's really phenomenal. So lots of improvements have been made throughout the system for that.
Okay, but if we're depending on high level of accuracy, then we want to, and you're advocating for the PCR test, the quicker the results, the more satisfied that person would be that they need to, what they need to do to take care of themselves or their family. So we've maxed our capacity and our staff so that we could not do it faster no matter what, is what you're indicating here?
I don't know. We can add sites, but we can't make each site faster, to be honest. We can add sites so that there's more availability and people don't have to wait in line so long or go so far from their homes to find a site.
We're talking about results. If you add 500 sites, that won't get you 500 times faster results. So the question I have is, what could we do to expedite the results?
So that is what I brought to you, which was to say that we could have HR support get those Binax Now boxes, take them to Stagg, Chavez, Edison, Delta College, the sites that they're at, plus the sites we're asking them to go back to, and at least have them do that at a cost. And I believe you have to all decide if it's worth it, because the PCR tests are resulting in 24 hours. Somebody might be smart enough to stay home and isolate while they wait 24 hours for their result. But as you said, maybe they wouldn't, and they'd go to a party and do something in those 24 hours to infect others.
Sure. So, Mr. Dietrich, same question to you. I'm unable to get an answer, and maybe there might not be one from Dr. Park because this might be in your department. What could we do if the PCR test is most reliable? And I appreciate that we're going to be getting the antigen test out. It's exactly what we had talked about a week ago with CAO Wilverdine. So I'm glad that he's engaged with Dr. Park and District 2's representative Kathy Miller's engaged. So we have an issue and an interest for antigen testing and for the information of positive or negative, as Dr. Park aptly points out, that the PCR test is most accurate and most reliable. And I'm asking, what, if anything, is it a staffing issue? Is it more equipment issue? Is it logistics? What could we do to get the most accurate testing results in a faster turnaround time than 24 hours, 72 hours, whatever it may be, as the loading of testing increases?
So that would be our internal capacity with our public health lab. As Dr. Parton mentioned, HR support is able to expand and has a quick turnaround time. Our lab, we have a surge plan, but that surge plan basically means I'm doing nothing but COVID testing. So TB, other public health lab testing would be set aside. As you're probably aware, we are mitigating outbreaks within the jail and certain school settings. So what we have there is an ability to do more. But as Dr. Park mentioned, that there is the process of acquiring the specimen. Public health generally does not acquire the specimen. They use, our partners in correctional health and other partners to acquire the specimen. That then gets shipped to public health or, driven over to public health. We do several runs per day, but there's an extraction process, the PCR process. So as Dr. Park mentioned, if we get specimens at 9 in the morning, we're running, several hundred of these in batches. The results would be at 4 o'clock, and then how do we communicate those out? I think what Dr. Park was also alluding to is some of the labs that are doing PCRs are not integrated with CalReady, and that's an important piece that when there's a positive, that will flow to CalReady, and our contact investigators can then actually get on those cases right away. So we have a surge plan for public health that can play a role, but our capacity in the public health is on a surge day, maybe 800 tests. A lot of these are, like I said, we're doing serial rollouts in certain areas, like in the jail and other areas where these individuals are being tested several times a week. But I think our option really is to support HR support. They have been a partner with us for well over a year. Back in June, some of these sites and some of the state sites were well under 10% of their capacity, and that's why they were being basically scaled down. Now we're ramping them back up. As Dr. Park mentioned, we have some Binacs. I believe the quantity of Binacs we're able to redistribute is on the order of 17,000, so it's not an unlimited supply.
Okay, I'm still not getting an answer, and perhaps one doesn't exist. Imagine today that we did 1,000 tests and our load capacity would be dramatically higher. And maybe we're doing 1,000 tests a day. Maybe we're doing 2,000 tests a day. We might be doing 20,000 tests a day. I really don't know. But let's say we surge, and I'm asking what exactly, if there's any possibility, that we buy additional equipment, that we have more staff, we hire another laboratory. What specifically could we do to increase the turnaround time so that we get the most accurate result, the PCR, the most accurate test that's out there, that result, instead of taking, and if we're getting it in 6 hours, if it's in by 9 o'clock and out at 4 o'clock, that's great. Somebody might get tested at 2 o'clock and they may not know anything until the following 2 o'clock. That's 24 hours. Maybe that person's gone to work. Maybe that person's done other things and exposed other people. What possible opportunity would there be for us to have a faster, and it may not exist. This may be the most impossible question I'm asking. I got results within an hour. Yeah. What would it take for us to get faster results?
And the quantities, if I look at the state dashboard, I think we're doing approximately 3,500 to 4,000 PCR tests a day in our county. I know that by what goes to CalReady. There might be other PCR tests that are done that are not reported. But by you going to a hospital that has their own internal lab, it's not collected specimen, sitting there waiting for the courier to pick it up at 4 o'clock, overnighting it or whatnot to the lab in Southern California. If we start to squeeze out those stalls, if you will, where it can immediately go to the lab, but these are run in batch. So the best thing is to work with our partners to how can they, rather than one courier run a day, do multiple runs? Can we use labs that are more geographically located rather than sending them to, Valencia is the state lab, but that's in Southern California. As I mentioned, we have some lab capacity. I don't have the physical square footage in our public health lab. If you've toured that lately, we're stacked. It's shoulder to shoulder in there right now. What we could do internally is, if we had staff, additional laboratorians, which are tough to come by, work nights, weekends, but that's a sprint at this point, but it can't, probably not something sustainable. But the PCR test in our public health lab, we could probably ramp up more. But as I mentioned, we're focusing that resource primarily on outbreaks rather than surveillance.
Understood. Okay, well, if the need were to arise where we got a massive flow of testing, because we want this to happen, we want to collapse the spread of COVID, and if information is paramount, if maybe for a short period of time we redirect resources, bring in temporary hires, outsource to another laboratory, maybe set up a temporary laboratory. I don't know what the state laws allow, but maybe we buy another piece of equipment for testing. If I remember correctly, about a year plus ago, we had one machine and we had brought another one online, and then is it possible to get a third machine? So we're processing more.
Well, at that point, maybe bringing the device closer to where the specimens are acquired, and I'm not the expert, but I know there's a third, other than PCR, there's a NAT nuclear amplification testing. And be honest with you, I went to Maui in July. My test did not come back in time, so at the airport I had to pay pretty pricey, but they had something there that wasn't PCR, but it was ran pretty quickly, and I think it was a nucleic amplification. And I don't know if Fulgent or other vendors, it seemed last summer there were some that could provide that device in the field and maybe rapid turnaround time. But Dr. Park would be more of a subject matter expert than myself.
Okay, well, shifting then to Overdeen. Last week at our hospital review meeting, we had talked about this, and I'd asked you to engage with Dr. Park and see what we would do. Could you kind of give an update? Where are we with activating and mobilizing some of what Dr. Park talked about?
Good morning, Chair Patty. A lot of what Dr. Park and Mr. Dietrich just talked about was a result of what we have been working on. There are obviously the medical folks who are able to be on the front lines and in the field. What I can suggest is that we do have the resources in our ARPA account, and I can work with the auditor's office to bring to bear any resources that we need when we need them in a timely fashion to get things deployed. But I would be on the back end of that. And like I said, we've been working together, all of our offices, in order to come up with the dialogue you've just been hearing Dr. Parker and Mr. Dietrich
And just to add to that, we fully intend to work with HR support to expand that their Binax now and have them run antigen and PCR tests parallel. One of the things Dr. Park has not mentioned, my wife works in the education field, but all of the schools since mid-April have had the opportunity to sign up with state-funded vendors that will supply both PCR or rapid antigen tests to the schools at school site levels in partnership with the Valencia lab, and I know Dr. Park is working with all the school districts to implement that as broadly as possible at school sites. So.
Excellent. So we'll be able to go in motion then and go through purchasing and CAO's office and actualize everything that you're talked about and everything we're in need of for the county, correct?
It seems to me that there's a consensus here that you would like us to move forward with that, so if that is the direction we
Well,
are
we'll hear from the rest of the board, but I would imagine
Sure.
so. That's
Our intention is move forward with HR support as well as Fulgent and basically all of the above as possible.
fully agreed. One last question, and I'll bring to the board for their comments. The antibody testing, if somebody had never had COVID, they wouldn't have any antibodies. Would that be correct?
So it would depend on what type of antibody you're talking about. They should not have antibodies to that exact SARS-CoV-2. There are some studies that are showing that other coronavirus strains have led people to test positive for antibodies to coronavirus, but not specifically that virus, but there could be some cross-immunity because of that.
Okay. But it would help then if a person knows, you mentioned a cross immunity, so there could be some immunity factors if you have that the antibodies and you do an antibody testing. Would it scale how much of the antibodies you have and what type of immunities you may assume, maybe not accurately, but you could, is there such a thing as testing low or high on antibodies?
So some tests might come back positive, negative, you have it, you don't, to certain types of antibodies, and some might give you a number, and the number is, as I said, not really something you could interpret, and even having the antibody doesn't tell you for what duration it will last and how protective it is. But there is one study, I think, that shows that if you've had some other form of coronavirus and you built some immunity to it, that might give you some protection, but it's only one study that I know of.
Understood. I can't speak for the rest of the board, but I personally, having had COVID, and we're coming up on 10 months plus, I'd like to know if I have antibodies still. I know that we've heard somebody come in with public comment and said they just had the antibodies tested and they have 100% immunity. And I don't know if that's a quantifiable fact or not, but I'd be curious, and I would like to include that in the options, because that is being offered through some of the urgent care locations, but it may not be offered right now at the county. Is that correct?
No, we are not offering it through the county. People who are interested in having a test such as that should go to their health care provider to have that done. In your particular situation, I know that people are curious to get that test, but as I said, even if you are demonstrated to have some antibodies, the recommendation is for vaccination and for using all non-pharmaceutical interventions as much as possible. But it is not available directly through the county. There are some vendors who are charging for it. I have looked into the site at the Sherwood Mall, called that vendor 3 times, and I'm not receiving phone calls back, so I don't know what type of antibody test they're offering out there. Supposedly it's a rapid one. And I really caution people to look at that and think that they're fully immune, even if it comes up positive. It's actually illegal for a physician or anyone in the medical field to give you results to an antibody test and tell you that you're fully immune. There's just no way of knowing, so that wouldn't be correct.
And Dr. Burke, can you comment, the antibody tests, the ones that are FDA approved are a serology, so a phlebotomy blood draw, not a finger prick?
Yeah, so all of these tests that we're discussing are actually, like the vaccines, under EUA authorizations. They're not FDA approved. There are some, perhaps very rapid off the finger, that might have had an EUA, but none that are fully FDA approved. Just as the Pfizer vaccine just got fully approved with a biological license, dropped to the EUA, all of these tests are under EUA, and there's only one serological one that is FDA approved that I know of, and it is through a venous puncture.
One thought, if we were to offer the antibody testing, is it's maybe an opportunity to get somebody forward, engage, sense if they have any types of symptoms, give them some information, and maybe even get a test, an actual test, while they're coming in for information and find out about antibody. We might have the opportunity to engage with them at a new level of testing that they may not have considered when they first drove up. So that's, to me, just might be a helpful tool to engage the public with not only information but options once they are there. Would you think that might be helpful?
I think really if we're going to have our teams out there offering testing, I would like them to message more strongly vaccination than to confuse them with the idea of perhaps going after an antibody test with their physicians. I don't know how much time they have carrying on that discussion with people as they're doing the testing. It's a thought, and I think maybe the time will come where we'll know definitely more about it and know its usefulness. But at this point, I think it's kind of a conversation that we can't really successfully have without really knowing the usefulness of it. So I would rather have them engage on other conversations.
Sure. Okay. And one last question for you is the monoclonal antibody treatment being implemented at the county hospital. Can you tell us a little bit about that? Because I believe that's unique to this region.
It is available through the state, and we have pressed our hospitals to take it on, and San Joaquin General Hospital is the only one in our county that is administering it, but we've always had that site available. Very fortunate for us because there are some other counties having great difficulty finding anyone to administer it. But yes, our San Joaquin County Clinic set up a clinic with 8 beds many, many months ago, and it has always been on the table. And our providers are sent alerts and messages letting them know what the criteria are to get it. So they do have RegenCov out there at San Joaquin County Clinics.
And do we have any results of what that effort is? First off, how many people are getting the treatment and how effective it might be? I've read some very good and promising results from that type of treatment.
Right. So it is promising numbers when you look at national and state data. Obviously, President Trump received it, and Governor Abbott of Texas received it. I don't have specific numbers. Here comes Mr. Culberson, might have some numbers. I do believe overall the service is underutilized, but it is getting utilized.
Supervisor Patty and board members this morning, Chair Patty, we've seen an increase over the last 2 to 3 weeks in the monoclonal antibody usage at the hospital. Dr. Capre and other physician leaders have really pushed this among the medical community. I believe we're seeing between 2 and 5 treatments a day, but that's up from 0 about 2 or 3 weeks ago. I don't know of the efficacy. I believe it's quite successful, but again, it's the frequency that I monitor on a daily basis really has picked up in the last 2 weeks.
Excellent. Well, I want to compliment Dr. Park and Mr. Dietrich and Mr. Culberson for bringing in something that's there. I know we keep talking about what types of treatments and what more can we do and thinking outside the box. So I appreciate the engagement with a treatment that is looking very promising, and I guess we're seeing some positive results. Bringing it to the board, District 2 Representative Kathy Miller.
Thank you. First of all, Dr. Park and Mr. Dietrich, I want to thank you for responding so quickly to the concerns raised from my office through constituents, and then also the discussion last Wednesday with Mr. Culberson in our healthcare services project meeting. It's great to see us ramping up so quickly. There is a tremendous need for the rapid tests. And while I appreciate that perhaps as more PCR tests begin to occur, that the turnaround times may slow a bit, in my mind, it's more important to make more of those rapid tests available, because purchasing more equipment and taking on more staff, those are really permanent investments that we may not need down the road, and they're very, very expensive, whereas the rapid tests are much more cost effective and we can deploy them very quickly. I realize they aren't as accurate as the PCR tests, and in every instance, I would support having both of those available at the same place, the same time, so that it's just assumed, well, if you want the rapid test, we do this one as well. That's just the way we offer it. And I think people who want a rapid test, they will have the PCR test at the same time. So I support developing a contract quickly, an addendum with HR support for the county to take on the $10 if that's required. I also think there really could be some value in those Fulgent kiosks, they're kind of flashy. They're new. You can put them in high profile locations. And I think that actually it could be worthwhile to also look into those and do a certain number of them. It also allows us to make sure that we put one in Lodi, we put one in the city of Tracy, we put one in the city of Manteca. But I think I don't think that'll have to be a long-term contract, I guess is what I'm saying. I think during this surge, I think it would be really beneficial, though, to the public. And I think working with the schools, that's critically important. We need to make sure that if a child is sick, that schools have the ability to get some kind of a rapid test provided for the student and their family. And we also need to make sure that the schools are properly enforcing closures so that they aren't just automatically sending a whole classroom of kids home. Perhaps they just need to send home the children who are more at risk, who have been actually exposed. Whatever the protocol is, I just want to make sure that we continue that training. I know we've done it, but I think it's going to take a while for it to filter down. So I want to make sure that we keep as many kids as possible in school. And finally, I'd really like to explore the possibility of also having vaccines available at the HR support vaccine, as many vaccination sites as possible. So cross-pollinate. At the vaccination sites, we should be able to have Binax tests available, and at the testing sites, we should be able to have vaccines available. I think there is a certain number of people that if they're not feeling well, and all of a sudden they're thinking, oh, if I have this, I am going to miss 2 weeks of work. I can't afford that. Or I own a business. I can't afford to close my business for 2 weeks. What am I going to do? Even if they find out they get a Binax test that's negative, if there is a vaccine available right then, they may say, I don't want to risk this again. I'm going to go ahead and get a vaccine now. And especially with if it's the Pfizer vaccine that's offered, because that's got the FDA approval. I just feel like we need to cross-pollinate as many of these sites as we can, because you're right, getting more people vaccinated is really the ultimate goal. Because, you get a negative test, all that means is you're negative right then, that minute. It doesn't mean that you might not be re-exposed and you might be positive 48 hours from now. It's a snapshot. And so I think vaccination is the goal. So I think we need to make it as easy as possible for people to make informed choices and act on that. So from my standpoint, I agree. We need to expand testing because we are hearing from all over the county residents. They need it, they want it, and they want it to be easier. You are right, Dr. Park, the Sherwood Mall site that is independently funded and independently operated, it was a nightmare when my staff went out there with your staff. There were people standing around in 100-degree heat. There were no shade structures. There was no water available. There was a whole bunch of people that were clearly ill. There was a lot of people coughing. There was quite a number of people not wearing masks in fairly close proximity to others. There were children with parents there. We need to avoid that kind of situation as much as possible. And I shared with you a testimonial from a constituent who had a sick child. She has little ones. In trying to find a rapid test, she eventually went to 3 different retail outlets with a sick child in tow because she couldn't leave the child with anybody. She didn't have anyone to watch her child. And ultimately, she and the child and her other child tested positive and became quite ill. there is no telling really how many people they might have come in contact with and exposed to COVID during those 8 hours that they were searching for a test. So I just think we need to do as much as we can. We have the ARPA money. If it's possible, CAO, I don't want to wait to bring this back to the board. If you have the authority to utilize those funds for a COVID response, then I am in favor, and I know we're going to hear from the rest of the board. I am in favor of using it to expand rapid testing, all testing, and vaccine accessibility in San Joaquin County.
I believe we could make that work, Supervisor Miller, within purchasing authorities up to $200,000. So it'd definitely be a good jump start.
Excellent. Thank you. That's all I have.
I just
Vice
want
Chair
to
Wynn.
say, oh, I'm sorry. I just wanted to respond to Supervisor Miller by letting her know that we will be conducting 2 trainings in the next couple of weeks with our schools, go over modified quarantine rules and shortened quarantine rules so that they have a full understanding. So we've already reached out to the Office of Education at the county level, and they're going to assist with getting the right people in that meeting.
Great. Thank you.
Thank you.
Vice Chair Wynn. Questions?
Yes, thank you. Again, I always appreciate the information provided by Dr. Park and Mr. Diederich, and had many conversations over the months, and I obviously see we're making some progress. One of the things that I appreciate, certainly with Supervisor Miller and Chair Patty's comments, is I think we're all looking for a solution and the best way to address this pandemic as it continues to evolve. I think the uncertainty obviously is concerning a lot of individuals, and I think the one thing that continues to be kind of the elephant in the room is vaccinations, which oftentimes I think gets distorted in some regard. I think one of the things that I see, and again, I want to make sure that Dr. Park, you understand, I'm not attacking you. My disagreement is with the state CDPH, our governor, and health officials in some regard at CDC, et cetera. Not that I dismiss the science, but I've had the opportunity to read things from professionals who've admitted that they don't have the answers or all the answers, and it's an ongoing process. And yet, in some cases, it is presented as that this is exactly, the facts as they occur when it's really a hypothesis, or it's maybe some type of opinion, and I guess that's the concern that I have, is that I have no problem with leaders like yourself and others, and I'm not pointing to you directly, but certainly those in healthcare authority who normally don't admit that they were wrong. And as we've gone along, as we've seen, there were decisions made in the beginning that were wrong. We can argue, forever about this or that as far as the effectiveness of masks, and we can also talk about, now we're even talking about the effectiveness of vaccines, because just a few months ago, even from the president himself, he said, you can take your mask off, you're good to go. Well, that hasn't happened currently. So one of the things that I am in agreement with my colleagues is that I think we need to explore all the opportunities or options available to, one, provide the necessary testing that would allow those individuals to make a quick decision in regards to their behavior and where they go or don't. But on the other side, and I think this becomes the logjam, is that, we continue to, lack of a better term, attack those who have made a decision in regards to their own health care. And I think that's wrong. And I have no problem with people who want to wear masks, and I certainly would not criticize them one iota. And I think that's probably the way that both sides ought to look at the issue, that we can have a disagreement in regards to the way we behave, but more importantly, I do have a concern that somehow You know, we have two classes in society. We have the smart class and the dumb class. The smart class are those who wear masks and get vaccinated, et cetera, and those who don't are dumb. And I don't buy that. And I commented, and again, this isn't directed to you, but I commented in our last meeting that why are maybe as high as 30% of healthcare professionals who've treated individuals with COVID for almost 2 years that they don't want to get vaccinated? And I don't make any judgments on that. But I do question, you know, from those individuals who should know best based upon their own personal firsthand experiences. And I've read a number of studies and articles, et cetera, about both sides. So all I'm saying is that I think that one of the things that becomes a hurdle of sorts is that when government says that and we get to a point of mandating, as we see in some segments, which you talked about earlier, of the workforce. The question arises is why would an individual, when for literally decades we have heard time and again about one's ability to maintain control over one's body, my body, my choice, thousands of times. My point is that it is important. It is important to understand that for a variety of reasons, especially in our minority communities, I won't even bring up Tuskegee and things like that, but there is a historic concern from some communities in regards to healthcare. And I'm not making any judgments. All I'm saying is the facts show that we can march towards the same goal in reducing this increase in cases, et cetera, to protect the health of individuals. But I think everybody, and you know, myself considering, you know, I'm in the, quote, risk class, that before we had the vaccine, I was very aware of my surroundings and the meetings I went to and all those other things. I think most individuals are smart enough to figure out what they should and shouldn't do. And yes, there are those who are responsible. I get it, but the irresponsibility covers all areas of society. So again, I want to thank you for certainly your efforts. I do have a couple of questions in regards to when you talk about the antibody test or the vaccines. For example, if you're going to get the vaccine, usually one of the questions they ask you, have you been exposed to anybody for 2 weeks, prior 2 weeks? If somebody were to get an antibody test because maybe they in their workplace or whatever perceive that maybe they've been in contact by somebody who's had the virus, and they get the antibody test, wouldn't that qualify for a requirement that they not get the vaccine for 2 weeks? I'm not sure when we talk about, you know, cross-pollination that in the real world that necessarily works in every case. Could you kind of expand on that, of how we can do testing and vaccinations when the reason for the testing is because of the potential for exposure, and yet the vaccinations have to be, you know, a 2 week period before you get the vaccination? I just want to see how that would work.
I think I'm understanding your question, and that is about the usefulness of an antibody after known exposure. So the issue is, if you get a test with your antibody and it comes up positive, you don't know if it's from the exposure you had 2 weeks ago or from some exposure you weren't even aware of 4 months ago. And we don't know the durability of that immunity. It's a difficult topic, and I think a lot of things still have to be studied. At this point, the kind of antibody tests that people are getting are immunoglobulin tests, mostly IgM, IgA, IgG being the one that stays around and the one that would persist longer and be positive longer. But that doesn't give the whole picture of one's immunity. We don't know how much the B cell response and the T cell response, other arms of your immune system, are called into play when you have a COVID-19 infection. And could you have zero antibodies yet have protection from your T cell response? So much of this is unknown right now and still being studied, that I think at this point, this is why we can't apply those results to reality, and we have to tell people to be very wary of any result that gives them this, that could be giving them a false sense of security. However, it is true, multiple studies have shown that people who have had COVID in the past have some evidence of neutralizing antibodies that do render them immune for some period of time. So there are multiple studies that show that as well, that there is some protection. And the protection might last 6 months, maybe longer, but for sure that some studies have shown up to 6 months where the antibody is still present after a known infection. So it is very promising to look at that and to see that, but it's only really useful when we're studying these people in seroprevalence studies. To narrow it down to an individual and say that it's useful to the individual is very hard to do because we don't understand it enough. But studies so far are showing that there could be some immunity. However, there are studies that also show in real life, not in vitro when you're looking at in a lab and putting someone's blood in the petri dish and seeing if the neutralizing antibodies are there, but in real life, when we look at people who have had COVID in the past, what we're seeing is that those who are vaccinated are still doing better than unvaccinated in some studies. So I think the science is still very much out there, and what we're seeing in real life when we look at people is that it seems to be still a benefit to get vaccinated. I understand everything you're saying, Supervisor Wynn, about choice. I make no judgment. It's really not my place to judge whether someone gets the vaccine or not. I don't think of people as smart or not smart. It is something, though, that when I look at the data, I can see, and we can see through numbers, how people are surviving better. And so I feel it's my duty to show them the numbers, because the numbers really can't lie. When you look at who's in the hospitals, when you ask our 7 acute hospitals, who's in the hospitals, it's our unvaccinated folks. And that's just the reality. So that's proof enough for me to say the vaccines have worked to this point. Maybe we need third doses now, booster shots, because they're waning. But to this point, they've done what we said they would do, which was to decrease the incidence of severe disease, hospitalization, and death. That's really panning out in the numbers.
I don't disagree with that. Maybe you misunderstood what I was saying. I'm not suggesting, because I think the facts show, as you talk about, the facts show that vaccinated individuals, if there's a breakthrough, for example, that the severity of the illness would be much less with a vaccinated individual. Yes. I get that, and I think that's a fact that can be provided to influence individuals to get vaccinated. What my question was is, if, for example, I want to get vaccinated and I go through the form and it says, have I been exposed to somebody, who's had the virus, in the last 2 weeks? Basically, it's saying I can't get the vaccination for 2 weeks. So if I go get an antibody test because I want to find out, or a rapid test, for example, to find out if I've been infected or whatever, or had it, just the mere fact that I think that would qualify me for the 2-week wait, because I am assumed that I've been in contact. So my question, and I don't want to, beat at the dead horse, but my question is, so if we're doing the antibody testing or the testing period to determine, one's physical state or health state, then at the same time we're talking about vaccinations side by side. The mere fact that somebody shows up because they perceive that they've been exposed, wouldn't that automatically disqualify them for getting a vaccine right then?
Okay.
And one last point, to Chair Patty's comment about his exposure, he said that he felt fine, but then a few days later, he became ill. So somebody may feel well, but they've been exposed at work or home or wherever. And then, but just by virtue of that thought, I guess the protocol would be that then you would wait 2 weeks to get your vaccination. Again, I'm not trying to make it complicated. I'm just wondering, if somebody thinks they've been exposed, Normally, there's a 2-week waiting period before they get the vaccination. So testing and vaccination may or may not be compatible. That's all I'm asking is how do we...
Okay, yeah, I understand now.
Okay.
So it used to be that if you had had a recent COVID infection, there was some thought that maybe you wait 90 days from that infection before you get vaccinated. That was removed by the CDC to the point where there's really no wait time. If you've had COVID infection, you could still get your vaccine. The 2 weeks doesn't come from a time period that you need to wait to get your vaccine. It's a strategy we use to make sure that people who might have COVID are not standing in line with people who don't have COVID for their vaccine. We didn't want them arriving at our vaccine centers and our vaccine sites if they had been recently exposed. We wanted them quarantining at home as they were supposed to. So that's where the 2 weeks came from, when our quarantines used to be 14 days and not 10 days, and we told people, you have to stay home, you've been exposed, we don't want you showing up at a vaccine site. The concept of doing, a test and then a vaccine at the same site, I think is still useful when you're talking about co-locating. I would definitely insist that there be 2 separate areas, at least 6 feet apart, 1 line for testing, 1 line for vaccinating, and I think that people who get tested in general would maybe not be the same people who would get vaccinated. I think there might be 2 separate lines. Certainly if you got tested and you were negative with the rapid test, there's nothing to say that you couldn't go over to the vaccine line and get vaccinated. And if you were to become positive a few days later, there's nothing to say that that was wrong as far as timing goes scientifically. It was just a measure that we used to keep people quarantined once they knew they were positive.
Okay, that makes sense. And again, I hope that we can provide factual information, logical information, reasonable information to the public so they can make their decision as to how they want to proceed. Right. One quick question for Mr. Dieterich, because you and I have had this conversation about the PCR test. My understanding is that there's a 40-cycle process normally to make a determination as to the sufficiency of the COVID virus in the test itself. Is that correct? There's a cycling process on how it's tested.
For a PCR test, they basically take the sample and it's a cycle of heating and cooling, and I believe that's referred to the cycle threshold. And if you had a higher viral load, you would turn positive with a lower cycle threshold. But Dr. Park would be more the expert there, and if that really correlates with the severity of the disease.
Yes, so when you do a PCR, as I said, these are amplification tests. So they're part of the NAT field of test. And so you're looking for viral RNA products, fragments, and you need to amplify them in the lab to finally see them. And how many cycles of a test you have to run before you actually detect it. If it only takes 1 or 2 cycles, that's a very high viral load because it showed up right away. So that's a low cycle threshold. In general, the CDPH uses a cycle threshold of 32 as a bit of a cutoff. Anything less than 32 is considered low cycle threshold, very likely to be a real positive. Because of the viral load of the Delta variant, we're seeing very low cycle thresholds. These labs are going through the whole testing process and not having to go through several cycles or runs before you detect or amplify that RNA. And anything above 32 is questionable.
Okay, well, and the reason I brought that up is the question was 40 cycles as opposed to 27 cycles. That 27 cycles would show a positive or whatever. So, and again, going back to the testing process, I got a test back in February of this year. I did it 1 o'clock in the afternoon. I had the results by 6 in the morning. I don't know what the currently is, but it's pretty fast in the normal process, and I assume with the changes that we're probably within 24 hours with the vast majority of the testing process, which I think if you're talking about work or family or parties or whatever, that should be sufficient to put your life on pause at least for 24 hours to make sure that you don't go out and infect a group of people. So anyway, that's my question. So thank you.
Supervisor Villapudua, any questions or comments?
I just want to thank you for all your hard work, and I know it's a tough job. I know in my district we had the last 3 vaccination sites we had, nobody showed up. So it's tough to get people there, and I know we're under a lot of pressure to get people vaccinated, so it's hard to get the public to come out. But my message is, hopefully, Ms. Roverdine, if there's funds, whatever Dr. Park needs, we can please help her out. Thank you for your time.
Thank you, Supervisor.
Supervisor Rickman, any questions or comments?
Thank you, Chair Patty. Good morning, Dr. Park and Mr. Diedrich. How you guys doing today?
Doing well.
Good. Well, thanks for being here. No, I confirm with my colleagues, and I think it's a good idea to have the rapid test, however we need to do that. But the question I had, and I had this question from one of my constituents, in showing the dilemma of the PCR test and the time frame, is this gentleman's wife is she's gonna give birth to a baby here in probably about a month, and he has to have a negative test. And so he has to go to Rite Aid or some of these other places, but they're in between, 3 to 5 days turnaround time. And they won't let him get another test while that test is still outstanding. So you can see that his dilemma, or the dilemma is, if she goes into labor during that time frame when there's no test, what do? So the importance of having that turnaround quickly is, it's hugely important to this family. It would be to me also. So what's the recommendation on something like that?
So when I showed the slide on state public health orders, there was one from August 5 on hospital visitations, and that order has been amended to allow for people in certain situations to not have to meet the vaccination or testing requirement. And so certain situations would include end of life. You have somebody who's at the end of their life, maybe you didn't have any time to plan or you didn't know that was going to happen, so the vaccine and testing requirement is waived. In other situations where they're not waived, you do have a 72-hour window to get that testing done. Labor and delivery is another item. Pediatrics, people with developmental disabilities needing to have a support person. Those are situations in which that testing and vaccination requirement is actually waived.
So let me get this straight. So what you're saying, that if his wife goes into labor and he doesn't have that 72 hours because it expired, now he has to get another test, he can go in there and see his spouse?
That the hospital should let him in according to CDPH laws unless the hospital has chosen to make their own more restrictive rules.
Okay, well, that's apparent. Let's go with that. The hospital made more restrictive rules. So we're still back to, how does this individual get a test that can overlap so there is no gap? Is there a way for that can be done? Is there a way, like Supervisor or Chairman Patty got his is an hour? Is there an emergency protocol that he can go to and get a test and get the result in an hour?
At this time, you would go to one of Joan Sing Song's events, which I just showed the calendar. She is going to be moving around. By the way, her testing events also include vaccinations. So she does both at all of those events. So the calendar that I showed, she will have Bionax Nows with her and PCRs.
Is that the pop-up clinics?
Yes, yes.
So they can go to one of these and get that rapidly at that time so he can go watch
she will have the rapid antigen 15-minute Bionax Now test available.
But it's an antigen test. If they require a PCR test, that wouldn't apply, though.
The test for hospital visitation from the CDPH, I don't know which hospital you're talking about, allows for PCR or antigen tests to be accepted.
Okay.
And Supervisor Rickman, I know we had a MedMac call with the hospital CEOs and CMOs, and there's some discussion about that order and some concern with the hospitals not wanting to have staff doorways and have people screen for vaccine cards and whatnot. But I think where I'm going is the hospital, if they're going to have a more restrictive than the state, hopefully they're offering an outlet that this person who needs to go in and see his newborn baby, maybe the hospital itself could offer a rapid antigen test at the doorway for that subset of individuals.
Who would he contact if that's not the case? And the hospital's not going to budge. I'm just playing devil's advocate here.
You could give him my number, and I'll work with the hospital on that.
All right. All right, thank you. Is
that all, Supervisor Rickman?
There, thank you. I'll yield my time for now.
Okay, thank you. Dr. Park, I think all of us just got an email, and I want to read this to you and see if you have any, perhaps you can do some research and come back to us, because it's information or misinformation that could be helpful or harmful. We were sent a medical study journal published by a coroner who has avidly documented very strenuously that the vaccinated patients are riddled with spike proteins, clots, and more throughout the body. And they've sent this article to all of us, and I think you've been included, Dr. Park. So I'd like to get maybe some information on that article and that study, because there is a lot of, again, information and misinformation that can be out in the public and cause concerns and hesitancy. So if we can put a lot of those concerns to rest and put forward best practices throughout our county, that would be very helpful. And I think you've heard from all of the supervisors that I believe all of the above. Yes, we want the antigen testing. Yes, we want more pop-up sites. These are things that we talked about with CAO Wilverdine last week, and District 2 Representative Kathy Miller's talked to you about it. So I think it's all hands on deck and all of the tools that we could utilize so that we get the most amount of information, including PCR results, back to people much faster than what we saw last year at the peak was 5 to 7 days in some instances when the testing load was so high. So whatever we need to do, incorporating more laboratory, subcontracting out to local, another laboratory, anything and everything I believe would be helpful, because as you've pointed out, the antigen test can give false negatives and false positives, and that was a concern, your words, and very true. So while we want that, and people want that because they're getting ready to go travel somewhere and they feel slightly bad, and they may have a false negative, and then they go somewhere. So that PCR test that you have said is the most reliable that you believe we need to really utilize if that the public is wanting that fast result. So anything we can do to use all the above, I think this board has spoken about in favor of that.
Yes, thank you, and I understand, and we will work with CAO Wilverding on this as quickly as possible.
Great.
Without having read the study that you're citing, I don't know if I can comment whether it's been peer-reviewed or what kind of person has written the story, what kind of study it is. You know, the mRNA vaccines, as well as J&J, do use the spike protein as a way to instruct the body to make antibodies. So in a way to say that you're riddled with spike proteins, it sounds like a good thing. To say that you're riddled with antibody, I don't really understand the title. The clots, we do have some knowledge that the mRNA vaccines were connected to cerebral sinus venous thrombosis, which is why there was a warning label attached to them for women of a certain age, I believe 50 and over. And so people have a choice to perhaps choose J&J instead, based on their own self-education. This has not been widely occurring, but has been acknowledged by the CDC as a possible side effect, yes.
Understood. It's more information, the better. I appreciate it. And the high level of engagement that you have. I know this is on your plate 24 hours a day, 7 days a week, and you are very highly engaged in this, and we appreciate that as well for you, Mr. Dietrich. I know that this is our public health and public safety is truly job one, and we appreciate all of the effort that you and your entire team puts in on behalf of the citizens of the county that we all serve.
Thank you, Chairman Patty. If I may, in follow-up to Supervisor Rickman's question, I did just receive a text from EMS who has confirms that hospitals do have testing available for visitors.
Okay, very well. Thank you. Moving on, our next.
Supervisor, I believe you have public comment.
Oh, yes, you're right. Thank you, County Council. Public comment on this issue. Madam Clerk, what do you have at this point?
Thank you, Chairman. I do have a number of written public comments and one person that would like to speak in person. Would you like read public comments or in person first?
Let's do, I have a Miss Angela May.
Correct.
Is that the same one? So I'd like to call it Miss Angela May, please. And you do have 3 minutes.
Hello, thank you. Okay, so I had originally come here with a whole written script, but I'm actually very frustrated, and actually I would be lying to everybody here if I said that I wasn't angry at the moment, because we are still ignoring the fact that the maker and the inventor of the PCR design himself, before dying, actually said PCR tests should not be used as diagnostics for infectious reasons. It could not only tell you not what everything had to do with whether it was a coronavirus, SARS-CoV-2, which our CDC still has yet to prove 100% ironclad with material evidence that there are isolate samples, and that is actually a global issue established in 28 other countries. But we're still pressuring this issue of the vaccination. Okay, so if you have natural immunity, we have always been raised, if you have natural immunity, as some people say, your God-given born immunities are supposed to be the most genetically diverse issues for the human body. Now we're talking about, it doesn't matter if you're immune, it doesn't matter if you are antigen positive, which is supposed to be a good thing. And let me remind you, Kaiser, Adventist Loda Memorial, all of the Sutter facilities in this county are currently denying people if you don't have proof of vaccination. That is 100% a huge problem. People are being denied their basic care, their regular appointments, their well visits, their annual checkups, their pap smear visits, their mammograms, which, we have elephants in the room we're not talking about. Okay, if you have the vaccine, you are literally told to not get MRIs, to not get contrasting, to not get exams, to not get all of these different types of evaluations, because it might show something or it might actually compromise your health. Magnetic resonance imaging. Why on earth would these vaccines have an issue? Because according to Sinopeg, the manufacturer of the graphene oxide lipid nanoparticles components, graphene oxide is magnetic resonance recognizable. It could destroy the human body. Why is Sinopeg in China, out of all places, who is responsible for these outbreaks? Why are they manufacturing graphene oxide-based lipid nanoparticles for our ingredients? Our Pfizer sheets, our safety sheets, our EPA sheets, our fact sheets and everything else having to do with Moderna, Pfizer, and everything else, talking about all the reasons of occupational exposure. The elephant in the room, 13,068 deaths confirmed, 54,000 hospitalizations and increasing, 72,000 in urgent care, 98,000 office visits, 5,600 with anaphylaxis, 4,600 with Bell's palsy, 1,600 women have miscarried. Okay, we are experimenting on our most vulnerable populations, and those populations are not only vulnerable, those are the ones we are supposed to protect the most.
Thank you, Ms. May.
Why are we pressuring these people to get something that is the worst possible population to force to get these?
Thank you, Ms. May.
I would like to put these...
Madam Clerk. Madam Clerk, you have some submissions.
Thank you, Chairman. The first public comment is anonymous and writes, Dear Board of Supervisors, I am writing to ask that you take a stand on behalf of safety for all essential employees and require face masks while at work until the pandemic is truly over. I am an essential worker and I don't feel safe at work due to the fact that other employees and customers are not required to wear face masks and often do not. As a result, there have been many positive COVID cases in my office. It has been challenging and scary time to be a civil servant. I urge you to please think about employees and remember we have families that we want to protect as well. Please support and stand up for San Joaquin County essential employees and also the public that we serve. Please put people first. I personally feel a lot safer at work with masking and distancing. Centers for Disease Control and Prevention has provided updated information for fully vaccinated people given new evidence on the B16172 Delta variant currently circulating in the United States on 7/27/2021. Added a recommendation for fully vaccinated people to wear a mask in public indoor settings in areas of substantially or high transmission, in which sadly San Joaquin County is a high transmission area. Please follow the OSHA guidelines to better protect workers and the public. Thank you. The next comment is submitted by Amanda Petrosky, who writes, can the board please have Dr. Maggie Park explain why she is advising San Joaquin County school districts to only allow PCR testing for students suspected of having COVID, cough, and/or runny nose, when CDPH states that antigen testing is acceptable to rule out infection? Antigen testing is the same method used to allow nurses and educators into their place of work if they refuse to be vaccinated. Why is this not acceptable for school children? The next comment is anonymous and writes, hello, I would like to request that the members of the board refrain from attacking Maggie Park at every board meeting. Your behavior during her monthly updates has been appalling. She has diligently reported out the facts during this pandemic, as is her job, and each month you have escalated your assaults on her. Some of you seem to think that meeting is another episode of your very own reality show, and I'm embarrassed that you represent me. This is a public office you hold. You should be role models of respect and character. Please rise to the quagmire you have created and become pillars of your community. Thank you. The next comment is anonymous and writes, confirmation bias, the tendency to interpret new evidence as confirmation of one's existing beliefs or theories. Disinformation, deliberately misleading or biased information, manipulated narrative or facts, false equivalencies, drawing an equivalence between two subjects because they share some characteristics while ignoring the significant differences between them. This board has never taken this virus as seriously as it should. This board's inaction has caused needless suffering within our community. This board has failed to protect the citizens of the county by attempting to discredit highly educated and trained professionals and presenting results of their own personal Google searches as facts. 1,491 people have died in San Joaquin County. 64,328 have died in California. 618,000 have died across the United States. The overwhelming majority of current COVID hospitalizations and deaths are unvaccinated individuals. Stop using Google to spread fringe conspiracy theories about public health information when data has been made readily available to you in a detailed biweekly presentation for the last 18 months. Stop with the false equivalencies and the bombastic notion that after spending 4 hours on a computer at home, you now understand public health, viruses, epidemiology, and vaccines better than lifelong public health professionals. If the sheriff presented data to your board on crime, you would not go back at him 2 weeks later with the results of your Google search, so stop doing that to Dr. Park. Let's let the experts provide the facts and inform the policies and procedures that will maximize our health and safety. The next comment is submitted by Robin Cole, who writes, since it's obvious that 3 out of 4 supervisors do not have a clue about caring for their constituents, I'm asking that the boys on the board check their egos and political ambitions and increase COVID-19 testing capacity in San Joaquin County. Hashtag rapid test for SJC. As we have all seen, the lines for testing are long and waiting for test results takes days. This is having a great impact on businesses and their employees. It is getting difficult for some businesses to stay staffed. Please do more rapid testing and open more testing sites with integrated appointment scheduling. Thank you for your consideration of this impactful issue, and special thanks to Supervisor Kathy Miller for her tireless efforts to keep the community safe. Thank you, Robin Cole. The next comment was submitted anonymously and writes, why does the board request the public health director to present facts, but only have her present to push their agenda to influence their followers, often not representing many of their constituents? I thought the board was there to support and reinforce confidence in county employees and work collectively on decisions with county staff, not to bully, distort, or cause public perception that our health official is incompetent or does not do her research. COVID natural immunity has been shown only to apply to the strain of viruses that they fought and not any new variant that may come. So Supervisor Rickman should explain his interest on natural immunity. Maybe he wants to stop all vaccination or efforts to try and reduce the spread. Maybe in his non-medical opinion, he has decided that is what is best for everyone in our county. Maybe each board member should disclose their opinion on the COVID topic instead of trying to persuade those that are trying to present the science. As an observer, I see endless talking by some board members instead of facilitation of open conversations. I think there needs to be a collective change. The bullying, laughing under the breath, making jokes, sarcasm, and other behaviors needs to stop. The next comment is submitted anonymously and writes, The SUSD is not being transparent with the positive cases of COVID-19, and some schools blatantly ignore restrictions and safety practices. We need rapid testing in San Joaquin for the little ones attending school and the teachers who exposed themselves to COVID to teach our children. Not having rapid testing is negligent towards our community. Our community needs it. The next comment is submitted by Aaliyah Barnes, who writes, according to the California Department of Public Health, trained doulas should still be allowed into hospitals to support birthing families, regardless of county COVID cases. Evidence supports that when doulas attend births, birthing people are more likely to have a positive outlook on their birth experience, decreasing the likelihood of postpartum depression. There is a decrease in the chances of C-section, which benefit both the family and the strain on our healthcare system. The next comment was submitted by Sophia Colon, who writes, Dear SJC Board of Supervisors, our San Joaquin County needs expanded COVID-19 rapid testing sites to identify and contain the spread of this virus and its variants. Increased rapid testing sites are the best way to slow transmission, prevent more residents from getting sick and missing school or work, and preventing the virus from mutating further. This statement can be proven with many public health and medical research published articles. Through research, it was also found that increased rapid testing sites will promote transparency that is sought out by the Black and Latinx population, will have a positive impact on the behavior of San Joaquin County residents, and the interactions with healthcare providers solidified the seriousness of the matter, all just by increasing test sites. I work full-time, care for my family, including 3 school-age students, and help care for my disabled mother. I can adjust my work schedule to accommodate testing at Kaiser Permanente. When I tested last week, it took 30 minutes to move through the lines, and I received my results 2 days later. However, this is a very different experience for our San Joaquin County residents who depend on the county for testing. All San Joaquin County residents need more locations, more times outside of normal work school hours, and test results proceeded quickly to act and plan accordingly. Please plan to increase testing sites to support our county's fight against the spread of COVID-19 and the Delta variant. The next comment was submitted by Cody Sibel, who writes, trying to obtain a COVID test anywhere in San Joaquin is extremely difficult. Appointments are pointless because the lines are so backed up. Most of these places are full of our residents that are sick, standing in the sometimes 100-degree weather with no shade or water. The demand for testing has increased throughout the county as we are clearly in a different stage of this pandemic. I ask that the board please do whatever is in your power to obtain these testing sites, as well as give some comfort to the residents waiting in line for a test. Thank you. The next comment was submitted by Tejal Patel, who writes, I am asking the county to do more COVID-19 rapid testing and open more testing sites with integrated appointment scheduling to help businesses stay staffed and employees return to work safely. The next comment was submitted by David Singthe, who writes, Hello, Board of Supervisors. My name is David Singthe. I am a 16-year-old senior at Stockton Early College Academy. I'm a constituent of Kathy Miller and have been a Stockton resident since I was born. My comment is regarding the discussion of the COVID-19 pandemic. As many of you know, all districts in San Joaquin County will be entering, or already have been, entirely in-person instruction. As a student, I realized the gravitas of this pandemic and the strenuous course load during the final year of high school. Students like myself need options for expanded COVID-19 rapid testing. Often the long wait that comes with awaiting results from regular COVID-19 tests can be detrimentally affect our studies. I implore the Board of Supervisors to begin considering expanded COVID-19 rapid vaccination sites, such as the one in the Sherwood Mall parking lot. This is a common sense solution to getting tests and ensuring that students remain in the classroom with peace of mind that they don't have to worry about contracting the virus. Not only does this benefit students, but it also helps parents, teachers, and overall our entire county. Let's make the right decisions for our county and expand COVID-19 rapid vaccination sites. It makes sense and it keeps our community safe. The Delta variant of this virus packs a punch, and we should be proactive in our response to it to prevent another COVID-19 lockdown. We must do everything in our power to prevent that from happening. Respectfully, David Singthe. The next comment was submitted by Colleen Foster, who writes, I encourage the board to do all you can to increase COVID-19 testing in the county. Current lines are long and it takes too long to get test results. This is affecting businesses, schools, and the general health of our community. The board needs to take swift and effective action to address this ongoing public health crisis. Thank you. The next comment was submitted by Kimberly Wormsley, who writes, "Good morning, Chair and Supervisors. Councilwoman Wormsley here. I am writing out of grave urgency and concern surrounding South Stockton. This area is highly disproportionately represented in positive cases, but yet has very few testing sites. I'm publicly writing to ask for more testing sites and vaccine sites to fit the need of the community. It is disingenuous and dangerous to residents if we are not providing the tools to help curb the virus for residents who are gravely underserved but highly represented in COVID cases." The next comment is submitted by Amy Portello Nelson, who writes, "The last 18 months have been tremendously difficult for our world to navigate, with compounding traumas and challenges ravaging our people. Through it all, I've diligently taken care of my family and community through social distancing, masking, hand washing, vaccinating, and working to increase access to vaccines through my job. But this virus has continued to spread because not everyone has taken the same precautions. A few weeks ago, I woke up feeling like I had been hit by a truck. I knew breakthrough cases were possible, but felt unprepared for what to do when I had to figure out how to get tested for COVID. Websites were not updated, physicians had to wait, pharmacies couldn't do same-day appointments, county-sponsored sites weren't open on weekends, and the one rapid test site in the city had a wait of several hours in the sun with no water or chairs. It took me days to get a test and then more days to wait for results, which came back positive. During that time, my young, unvaccinated children contracted COVID as well. This is going to keep happening. The Delta variant is here, and more vaccinated people and children are contracting it. I still strongly support vaccinations. I believe it's the only thing that kept me out of the hospital, but we need to promote testing as much as vaccines. Please support more accessible rapid testing sites to help limit exposures, keep our community safe, adults at work, and kids in school." The next comment was submitted anonymously and writes, "Honorable board members, I know there will be a discussion of having more rapid test pop-up sites today based on Supervisor Miller's call for more sites. However, something you all should consider is whether these sites are going to be legitimate, law-abiding entities that have the community interest at heart, not their pockets. Some of the existing sites do not accept local insurance plans, meaning they have to be out-of-pocket costs, which can be as high as $400. You need to be cautious about who can do these tests in our county. Trust our health leaders to take the right steps and not call for something you have no idea what the consequences are." And Chairman, this concludes the written public comments that we have for this item.
Thank you, Madam Clerk. Our next discussion item for COVID is from our CAO, Mr. Wolverding.
Thank you, Chair. Good morning, members of the board. As I've discussed previously, San Joaquin County has been allocated $148 million in American Rescue Plan Act money in this last May, and we've received half of that, just over $74 million, and currently have that on hand for use. In fact, this Board of Supervisors has already started making commitments against it for homeless initiatives. Furthermore, my office is contracted with Beacon Economics to do a targeted outreach for economic recovery. I've discussed this a few times in prior board meetings, and that's with using our ARPA money. That plan, as I discussed, is due in September. However, we wanted to get the funds into our community as soon as possible, so we're leveraging on our previous CARES programs that we've used, which involved the small business and family assistance grants. And these are fully developed, ready-to-go programs. They were effectively used when we've used them over the course of the last year with the CARES money. And what we're proposing here uses less than half of our first tranche of our ARPA funds. And so here to tell us more, I'm going to turn it over to Connie Hart, our Deputy County Administrator.
Thank you, Mr. Wolverding. Good morning, Chairman Patty and members of the board. My name is Connie Hart, Deputy County Administrator. Before we talk about what we want to do moving forward, I wanted to give you a brief update on what we've done so far. This slide provides an update of what we've distributed so far under the Small Business Assistance Grants and the Family COVID Assistance Grant programs. We have completed 3 rounds of funding to the small businesses in the county. The first 2 rounds, as Mr. Wilverding said, were funded with CARES Act dollars. The third was funded with general fund savings that were realized partially as a result of the CARES Act funding we received. Additionally, in December 2020, we launched the Family COVID Assistance Grant Program that provides assistance to low-income individuals and families for the payment of rent, mortgage, and utilities costs. As you can see on the table, we have, or we very, very soon will, have distributed $25.6 million to small businesses and families experiencing financial hardship due to the COVID-19 pandemic. Before your board for consideration are increases in appropriations funded by the ARPA dollars to accomplish 3 objectives. Number 1, the Family COVID Assistance Grant Round 1 has distributed the entire $5 million appropriated by your board. The CAO is requesting additional appropriation of $1.7 million to fully fund this grant program and to cover costs incurred by HSA for the administration of the program. Number 2, we're asking for an increase in appropriations of $12 million to fund a second round of the Family COVID Assistance Grant Program with a target launch date of September 1st. And third, increase in appropriations of $20 million to fund the 4th round of the Small Business Assistance Grant Program, also with a launch date of September 1st. The total in increased appropriations requested from ARPA funds is $33.7 million. In order to streamline the application, review, approval, and payment distribution processes, we are also recommending the approval of an agreement with Yardi Incorporated in an amount not to exceed $580,000 for both grant programs. And additionally, HSA has negotiated a contract of $400,000 with El Concilio for the administration of the Family COVID Assistance Grant Round 2 program. So what's new? Drawing on our experience and expertise we've gained through the development and implementation of the grant programs, we have identified several areas of enhancement for the 2 new upcoming programs. Number 1, rather than using full-time staff who can only devote a small portion of their day to the review of small business assistance grant applications, E2D2 has hired and is in the process of training 6 full-time equivalent temporary staff to review and work with the applicants, while E2D2 leadership will provide final grant approval. Second, similarly, rather than using full-time HSA staff to review the Family COVID Assistance applications, El Concilio will be contracted to conduct the review process with HSA leadership providing final grant approval. Both programs will employ an online application portal that will allow the public to more easily apply and provide for a streamlined review and payment distribution processes. That's the Yardi contract that I spoke of. And the maximum grant limit for the Small Business Assistance Grant, Round 4, will be raised from $25,000 to $100,000, which is the same maximum grant that we had in Rounds 1 and 2. And the maximum grant limit for the Family COVID Assistance Grant, Round 2, will be raised from $5,000 to $10,000 per family. Chairman Patty, this concludes my presentation, and I'm available to answer any questions your board may have.
Thank you, Ms. Hart. Starting from my right, District 2 Representative Kathy Miller. Do you have any questions or comments?
Thank you. Yes, on both of these grant programs, I'm assuming that even if a family or a business received funding in an earlier round, if they have incurred additional losses, there's a date beyond which, and then they can apply for these rounds as well.
That's correct. Round 1 of the Family COVID Assistance Grant opened December 28th of 2020. The application process ended January 31st of 2021. So that was the limit of, so back to the beginning of the pandemic, they could show their losses, their financial hardship back to March of 2020, but the last day was January 31st. So anyone who received a grant, any family that received a grant in round one, their period of review would be from February 1, 2021 through September 30th of 2021 when we end this grant.
I was just going to say, what if they submitted in December when it first opened and they only submitted for expenses up to the day they applied, then would this next period retroactively go back?
It would go back to whatever that date was that they applied, yes, in fact.
Perfect.
And anyone who had not applied or received a grant in round one could actually show harm all the way back to March of 2020. That's part of the reason, just one of the reasons for the increased maximum grant amount of $10,000 rather than $5,000.
Great. And so what kind of expenses are reimbursable under both of these programs? So for businesses or for families, what's reimbursable?
For businesses, it's rent, mortgage, and utilities, both unpaid past due, and also reimbursement for anything that they've paid, begged, borrowed, and steal to make their rent payments, drain their bank account, whatever they did, that would be reimbursable. And for businesses, PPE is also reimbursable. For families, very similar with the exception of PPE. Rent, mortgage, and utility costs for both unpaid past due costs that would be paid directly to landlords and directly to utility companies, but also the reimbursement of those costs where they came up with the money and paid that. As long as they can demonstrate the financial hardship, and they have to provide very clear documented evidence that they paid those costs. Unlike the ERAP program that we're familiar with, that allows for self-attestation, we're asking for very, very clear documentation because we are doing the reimbursement piece as well.
So if they're going for reimbursement on rent, in either case, is there, does it require participation from their landlords?
Not for the reimbursement piece, no, it does not. Because the reimbursement will be paid directly to the tenant. Many of them do have, there's a form, if we're going to be paying the landlord for past due rent, the landlord must attest and sign under penalty of perjury that is in fact the case, that these are unpaid dollars. What we've seen in round one, that many times, even if those reimbursement, they have gotten that signed by the landlord, but that is not a requirement. The requirement is that we see the lease so that we know that's what was due, and then we show the actual canceled check or their bank statement to show the transfer of funds to that landlord.
And so just based on those two things, if it was the renter providing them, you would be able to ascertain, oh, okay, well, they owed a total of $10,000 in rent, and they paid a total of $8,000 in rent. Therefore, if they're claiming $2,000 in back rent, that would qualify. It would be, and then would it be paid to the landlord or would it be paid to the tenant?
If they still owe $2,000, then that would be paid to the landlord, and the $8,000 that they had paid would be paid to the tenant directly. However, there's a little wrinkle there because we want to maximize the use of the ERAP dollars, which is actually on your consent calendar as well, because we want to maximize those dollars. We have engaged with the state Housing and Community Development Department, who will be overseeing that for our county residents. We want to maximize the use of that, so we will be encouraging, in a scenario like you said, where you have both reimbursement and past due, we'll be encouraging the applicant to apply to the ERAP program, which is only for past due, no reimbursement, for that $2,000, thus preserving the entire $10,000 max grant in our program. So in that scenario, if they also had an additional $1,000 in utility costs, we could cover that as well.
So there will be humans that will help individuals when they make contact, and I'm assuming 211 is the best entry into
El Concilio, part of the contract with El Concilio is that they will be providing a call center as well to assist people. But it'll be much more streamlined, much easier because it's an online portal rather than the way we did it in the past where they downloaded the application from the county website, completed it, and then emailed it to a dedicated email. That proved to be quite labor intensive for staff just to pull all those various pieces into a comprehensive, coherent application before the review even started. So this is a much simpler process, and the reviewers will be utilizing the portal as well. So it'll streamline everything, but El Concilio will have, yes, live bodies that are going to be reviewing these and providing for call center.
That's great, because so many times the feedback we get from constituents is, so I got involved in the process and then I get rejected and I can't figure out what I'm doing wrong or where the glitch is, and maybe there's another program I should be in. So having someone trained to actually walk people through this will be huge.
Yes.
Can I just request that we make sure 211 is absolutely knows that any referrals, they need the information to refer people to El Concilio.
Yes.
Because in the last couple of rounds, I mean, we have been really building this messaging. Call 211, call 211. That's your way in. You'll get somebody that can refer you to whatever program you need. Let's just make sure that 211 has the correct referral information so that folks can get plugged in, because I think there's a whole lot of people that are going to want to utilize both of these programs. And I love that you paid attention to what wasn't working, and we took steps to streamline and improve the processes. I think that's really great, and thank you for doing that. I think you're going to relieve the stress of a whole lot of people that live in San Joaquin County by making it easier to access programs. So thank you.
Vice Chair Wynn.
Thank you, Chair. Kind of touching upon what Supervisor Miller brought up, how are we reaching out to businesses to let them know that this program is available?
E2D2 has taken it on themselves to do that piece of the marketing. They have a very robust approach. They've got everything queued up, just waiting for your vote today before they release it. I hear them in the background. Because of their function as Economic and Employment Development Department, they have already a very robust database of businesses, and of course all of the chambers of commerce in the county as well. So emails are going to go out immediately. And they might want to come up and share with you a little bit about their program. They've developed the graphics and everything that's going to be needed. I've shared that with Jolena Voorhees, who's engaging in doing some social media around both of these programs. Of course, there will be a press release also, but I'm very impressed by what E2D2 has put together to immediately get the word out. Because quite frankly, if there's a lot of moving pieces to this, and it took me a little bit longer to get it to your board, we're still moving forward. But with putting everything together for a launch on September 1, and so if I had been able to get it before your last board meeting, we would have had a little bit more time to get the word out. But it'll be an ongoing effort that will absolutely start today. once your board has approved, assuming you do.
Well, I appreciate that, and I certainly appreciate the fact that we have databases that we can, continue to reach out. I just want to make sure that for those who aren't in our database or maybe aren't associated with their chambers, I'm sure there's a lot of associations, et cetera. I'm just hoping that every business, gets at least the word so they can make that decision to apply. The second question, and you talk about the application process online. Oftentimes, what you end up doing is you download a paper application, or and then you fill it out by hand, and then you scan it or whatever, or mail it. And then there's the other process where you have the ability online to fill in the blanks, and then that is sent back to the county agency, which, from my vantage point, sometimes is more efficient because if, as you said, if there's corrections that needed to be made, it's much easier to go back to an online document and change things as opposed to going back and reprinting the whole thing.
Exactly.
Which is that what we're doing with an online document, which they can revise without having to go through the whole process again?
Yes, they've actually, our contractor has taken our application, and we changed it a little bit because we're making a few little changes, but they've taken that document and created this online where you actually march through different screens, and there's a pre-eligibility screen that will ensure that they're actually, if we're on the family side, for instance, that they are at 100% or below the area median income. If they don't meet that criteria, and it does the math for them, if they don't meet that criteria, they can't move forward. They just simply don't qualify for the program. So make sure that they're actually a resident of San Joaquin County, kind of very, very pre-eligibility. And then once they pass that threshold, they go to the next screen, and they're just basically answering the questions and filling in directly on that computer screen. And on the back end, that the reviewer will see the completed application. So it asks for their income information, how their income was harmed due to COVID, all of those questions, and then it's required that they then upload the required documentation.
And I assume, based upon your comments, that we're getting better at the review process.
We are. It's been a long, arduous process from round one of the small business. We've learned a lot, and because that's not something that we normally do, or launch grant programs. But now I think that the CAO's office has the expertise that we could launch a grant program tomorrow if we needed to. So every iteration has improved, and I think this one's going to be it. And every iteration, every round has received more applicants as well. And so I expect the same to happen this time.
Yeah, I saw those in numbers, and obviously the review process and the approval process are joined. And I know this is in your staff report, but when you talk about households, small businesses, nonprofits, or aid to impact business such as tourism, travel, hospitality, I assume somewhere in there, because one of the areas that I guess maybe I'm most familiar with are restaurants or eating establishments. I assume they would fall into one of those categories for participation in the program.
Yes.
In any small business.
Any small business or nonprofit, as long as they have less than 100 employees, they do business in San Joaquin County, and they can demonstrate how their business was financially harmed due to the pandemic. Those are the primary criteria. And then we take a look at how much their business was harmed. For instance, if you have a business, we have this maximum grant of $100,000, but if their business was only impacted, their revenues were only impacted by $50,000, that becomes their max grant, that $50,000. We're never going to exceed the amount of hardship that that business realized. And then also, we're never going to provide grant funding that exceeds what those costs were. So if that 50,000 becomes their maximum grant, but they only show documentation of appropriate expenses up to 30,000, that's the amount of grant that they will receive.
Okay, good. Thank you.
Supervisor Rickman.
Thank you, Chair, and thank you very much for an excellent presentation. I support it. I'm glad to see it here. You know, small businesses took the brunt of the damage from the COVID here, and small businesses are the backbone
Yes.
of each community, and not just here in San Joaquin County or the state, but the entire nation. And anything that we can do to help them out. And I, know a lot of small business owners, and I eat out a lot. And some of them are still reeling from COVID, and hopefully this will help them, make them whole, and same thing with the families. One thing I want to ask, and to kind of piggyback off Supervisor Nguyen, I know you're going to get that information. You said you're going to push it out. You're going to push it out to chambers and so on, like Manteca Chamber, for example. Mm-hmm. But can we get that information also so we can push it out to our constituents, and you can shoot it to us by email? Because sometimes it feels like, we're the last, but yet we can reach a lot of people and businesses ourselves. So I would appreciate that. So thank you very much, and thanks for the team for doing an excellent job.
Yeah.
Supervisor Villapudua, did you have any questions or comments?
No comments, thank you. Thank you for the presentation.
Thank you. I have a couple quick follow-up questions. When it comes to individual, we are helping reimburse people that are currently unemployed, perhaps, and going through some financial hardships. Is that correct?
Not just unemployed. If they've had a reduction in hours, if they can demonstrate they were off work, say, for 3 months, 6 months ago, we can still cover that period even if they are currently employed.
Understood.
So long as they're below that 100% of AMI threshold.
Understood. So talking with a lot of local businesses, including restaurants, and I mean a myriad of businesses, they want to hire people. They have open jobs, but their staff is not coming back because they're making more money with unemployment, or equal amount of money, or adequate enough money by not working. Or they're requiring that you pay them cash so they can continue to draw money from the federal and the state unemployment benefits. What are we doing? What mechanisms do we have in place to perhaps call a person's prior employer and find out and verify that this person has in fact lost their job? Is that correct? And we can verify and validate that claim versus them being given more money for not working.
That's a very good question. What we have done, they have to verify, for instance, if they're laid off, then generally they'll have a layoff notice. They can also show us that they have been approved for unemployment benefits, and we've used that as documentation that they do in fact remain unemployed. Up to this point, I'll be quite honest, we have not contacted past employers, to see if a job is available for them that they're refusing to come back to. We can discuss that internally and get back to you as to whether or not. I hate to just make a rule without the input of the rest of our team, but at first blush, I think that would be an appropriate step for us to take, just to confirm that they haven't voluntarily remained unemployed. But if they're actually here's another little wrinkle to that though, Chair Patty. If in fact, similar to the business side, they actually have to show that their income decreased. So if the income that they show us pre-COVID and the income they show us with unemployment benefits post-COVID, if that's actually higher than what they were receiving when they were working, they're not going to qualify because they have not been harmed financially due to the COVID pandemic. If they're actually I actually had a similar situation that I dealt with, a disgruntled applicant in our round one very recently because he had lost an opportunity to make more money down the road, but he didn't actually suffer financial harm. So we look at that very, very closely. The pre-COVID income and the post-pandemic income, and compare the two. And we've actually found a handful of even businesses that have made more money, but they lost the contract. Well, I'm sorry you lost the contract, and you would have doubled your income if you hadn't lost the contract, but the fact still remains you made equivalent or more, in this case, actually more post-pandemic than pre. They just simply wouldn't qualify under those circumstances.
Understood. If a person were fully employed prior and they earned $48,000, and through the unemployment benefits and the extra to help out during a hardship, they've brought in $36,000, so we have a $12,000 gap. Is that all we're paying is the $12,000?
Well, all we're paying is the $10,000. $10,000 is the max for everybody.
Okay.
But yes, so we start with the $10,000, and then we look at their actual harm. If their actual harm is $8,000, then that becomes their maximum grant. Then we look at their appropriate reimbursable expenditures and past due costs. If those are only $5,000, that's the grant they're going to receive.
Okay, and so let's say somebody's going to be given $10,000, but they also owe their landlord. They've decided not to pay their landlord because I'm just creating a scenario that may or may not exist, but they're not going to pay their landlord because they don't have to. There's a restriction on eviction, so why pay when you don't have to? And what do we do? Do we contact a landlord to make sure that that person is not in arrears?
If the person is in arrears, if they're being truthful in their application, we're going to know that they have past due rent. If they have past due rent, then we're going to pay that. That's what's going to be paid first. Although, like I mentioned earlier, we want to maximize the use of all available funding, so we would encourage that applicant to go to the ERAP program that's being run by the state on our behalf, to cover the past due rent, because the moratorium on evictions is up September 30th unless it gets extended again. Those protections are going away, and to be quite honest, the applicants that are coming in, they're trying to bridge the gap and cover those costs so that they don't get evicted. So like I said, if they're being truthful in the application, we're going to know about that. And if they have the opportunity to go to the ERAP, if they choose to stay in our program alone, then we will cover the past due rent or past due mortgage first.
So the real big word there is if they're being truthful. So what are we doing to verify so that we're not being taken advantage of, and some of the dollars that can go to people that are actually in need isn't going to people that are working the system?
I see what you're saying. So you're saying a scenario where someone shows the months that they did pay and they're only asking for reimbursement and not tipping their hat that they actually still owe past due. That would be a very easy protocol for us to just add in, because they do have to provide their landlord's name and telephone number. I think that would be a very simple thing to add, is just one quick phone call from the reviewer just to make sure there's not any additional past due rent.
Well, and I would
That'd
suggest
be a good idea.
I would suggest that would be one mechanism of verification, and the second would be verifying with the prior employer what their person's status is, that if they're working the system and taking advantage of these benevolent payments and the benefits that are available for those that are struggling and in need, because many businesses were affected and many people were laid off. But I have heard from dozens. I'm a business owner. I've heard from dozens and dozens and dozens of businesses, and this is sometimes weekly when I talk to my customers, and my employees won't come back. That's what they keep saying. My employees won't come back. I've got work. I'm passing on it. I've got big companies saying my employees won't come back. So that's a concern.
And I'd hate to think that our grant is allowing them to do that for an even longer period.
That's
So,
exactly my concern. They're
I hear
taking
you.
advantage of the generosity, and we do want these dollars to go to those that are actually in need and truly affected. Lastly, what I didn't see in the information that's presented, in case I've missed it on one of the pages, is what has been the use of funds. How many dollars have gone to landlords? How many dollars have gone to individuals? How many dollars have gone to businesses? What's the breakdown on the use of those funds? I'm certain that we've had a robust program and levels of engagement. I just didn't see any breakdown.
I didn't break it down for you in the staff report, but I absolutely have those numbers. I could pull that data for you. I just gave you the gross dollars that have gone out the door on behalf of these applicants, some to utilities, some to landlords, and some directly to the applicant themselves. I would be happy to put that together and provide it to the entire board, the breakdown.
I think that'd be great
Most
and very
certainly.
helpful, and you probably left it out because I usually require about a 10-minute presentation so we can move on questions and answers.
This staff report could have been many, many more pages.
I appreciate that. I know that you and staff and everybody is working very hard and with a cross-section of departments, so we thank you, and the citizens thank and appreciate this. So I think that's all I have. Any public comment on this issue? We do have one in person, Ms. Angela May, and then we'll go to any written submissions or any perhaps anonymous attacks.
Hello, yes, and thank you for the presentation. I did want to make an important point here. The reality is that all of this money is based off of behested tax dollars. It's being guaranteed now based on the taxes that will be collected from ourselves, our children, and our grandchildren. So this is something that we have to take very seriously when we're talking about who's going to be managing that money. I did have one concern with the E2D2 department and the EDD. They're already still having problems with the unemployment right now. So I think it's pretty universally accepted and understood that I think the unemployment department needs to get their act straight. I understand that they're trying to wear more than one hat at the same time, and I understand that some people are capable of multitasking, but we also have the added obstacles regarding the unemployment fraud, and that's to the tune of billions of dollars of people who are not entitled. And so, yes, I do understand with this type of grant program, we would have to do the double checks and balances for that, and I think that that's important that we actually stay attuned to the issues that we're adding more onto an already muddy pile. One concern that I had was El Concilio. I personally believe that El Concilio is a conflict regarding the call centers, the data mining that they're already engaging in. They're already engaging in the pushing the message, the door-to-door program for the Healthy Future California program. Many people are unaware that Governor Gavin Newsom's personal law firm, Olson Remco LLP, is actually the location point for Healthy Future California that has contracted for El Concilio to do the door-to-door vaccine program. They are data mining. They are harassing people door-to-door. They did the courtesy door-to-door knocking at first, and this past week I was actually notified by several of my block members that people have been approached with very suspicious means, having their minor children in their arms, being absolutely terrified. Why would you sneak up on somebody? But for them to actually now be in charge of this call center, I think that we need to start picking and choosing who's going to have what access to what information to ensure that that data mining in each area is not being commingled for some nefarious action later on. And maybe that might sound a little paranoid, but this whole past year and a half, we've had people call conspiracy theorists, and more than half of what they're saying has already fallen true. And so I think we need to actually take into mind that issue. One thing that I do need to understand a little bit more of is why are we not helping the businesses that have had upstarts? Prior to 2020, I myself had an upstart that I was really excited about. Granted, I don't want this money. I consider it blood money. And so this doesn't apply to me, but I do know that there are other small businesses that have upstart expenses, and according to the criteria, they would be excluded from this help because it's not projected losses and upstart expenses that are being factored. I do think that needs to be considered because
Thank you, Ms. May.
businesses are equally important.
Thank you. Any written submissions online.
Thank you, Chairman. Yes, we do have one written submission by JLT, who writes, during the past year, our company was considered a non-essential business, thus no government relief funds were granted. We are so grateful for the grant provided by San Joaquin County. We appreciated not only their generosity, but they made the process user-friendly. Despite COVID, they made the process person-centered by making analysts available to speak with. No long hold time. Quite honestly, their team members made the process enjoyable. Unlike the arduous process I encountered with other government agencies, we appreciate your hard work and dedication to the residents of San Joaquin County. You truly care about keeping small businesses like ours alive. We can't thank you enough. Kind regards, Turner & Turner Electric Incorporated. And that's the conclusion of our public comments.
Thank you, Madam Clerk. We'll bring this back to the board for a motion. I would just conclude that I had given two suggestions of what we could do to maybe verify if perhaps you want to consult and work with the CAO and let the board know if and what you're able to implement as precautions and
Absolutely.
parameters. Thank you.
Chair, can I have a quick question?
Yes.
If you don't mind. What you were just talking about, upstart expenses. What if you do have a business that tried to start and bought, all the equipment and stuff, COVID hit and they lost everything?
Like I said, the extent of the allowable costs were our rent, mortgage, utilities, and PPE. One of the criteria is that the business must have been in existence prior to January 20th, 2020. Other than that, we're not covering. We've never even contemplated covering startup costs, but obviously a brand new business that was not able to make it, we would be able to cover those allowable costs. They would, a brand new business would have those kinds of costs as well.
Okay, yeah, I was just thinking, hey, if I wanted to, bought all my equipment, got everything, opened the doors, COVID hit, I didn't even get a chance.
I understand that.
All right,
that was just those were the parameters of the program as we set them out.
Supervisor Rickman, if I can jump in from Ms. Hart.
Yes, please.
So when this was first getting set up, somewhat year and a half ago, I think it was, and I was in the auditor role, I worked closely with the CAO's office when we were deciding what we wanted to set up parameter-wise, because this was all new. It hadn't been done before. We didn't have a yardstick to work off of. And one of the things that I had talked about with my predecessor and the assistant CAO back then was if we, where do we go? One of the things we wanted to avoid was funding a business that was failing not because of COVID, but COVID just accelerated the failure. Or something that was new. I think if you look at statistics, that what do they say, 90% of restaurants don't make it after the first couple of years, and that's just a normal statistic. Mm-hmm. The intent at the time from the CAO's office then was to try to put the money into entities, if you will, that were impacted by COVID, but for COVID would have been perfectly fine. So that was, I believe, the intent when this originally got set up.
How do you determine that?
At the time, it was they had to have, I believe it was 2 years of business activity under their belt, which is, I believe, what Ms. Hart was talking about.
That is what we set up initially, and then we found that there were several that were kind of falling through the cracks that were viable businesses that had been up and running. And so we actually changed that date of when they needed to start to be prior to January of 2020, which is just prior to the initial outbreak and subsequent lockdowns, in an effort to not have a legitimate up and running business not qualify because they weren't in place January of 2019.
All right.
So we did change that.
All right. Thank you. And thank you, Chair. I'll yield my time.
Any other comments or questions, or would need a motion to move forward?
So moved.
Second.
We have a motion and a second. This is adopted 4 yes, 1 abstain, 0 no. Thank you.
Thank you.
Next up will be our consent items. Also, going to our CAO, Mr. Wolverdine, you have an announcement regarding consent number 7.
Yes, I do. Thank you, Chair and Supervisors. Government Code 54953C3 requires an oral report on salary compensation before the board takes final action, and this is related to consent item number 7. Today's action recommends the Director of Employment and Economic Development appointing salary to be $125,848. Thank you.
Thank you. Any consent items to pull, starting right to left? District 2 Representative Kathy Miller.
None, thank you.
Vice Chair Nguyen.
None. None.
Supervisor Villapudua, none. Supervisor Rickman, none. And none for me. We have breezed through consent. Thank you.
Move to approve consent?
Second.
Consent has been adopted, 5-0. Thank you. We are next up for public hearing to consider the Planning Commission's recommendation to approve zone reclassifications, application number PA 1900157 of San Joaquin County, the Community Development Department, 1st District. Mr. John Funderburg, and Mr. Kwong, and Ms. Jolly apparently are all here.
Thank you, Chairman and members of the board. David Kwong, your Community Development Director. John's on his way down, and Deputy Director Jolly's with me here as well. I just want to give you a little bit of background first and context. A little bit over 2 years ago, this board gave us guidance and direction to hold off on any other code enforcement actions regarding the Marfagoa Mariposa community, and asked us to look at some alternatives for zoning issues out there, because there are a number of non-conforming situations where animals could not be continue to be raised, which were traditionally being raised generationally in that area. So what staff has done is we've worked with the community out there, thanks to leadership also from Supervisor Villapudua and Chris Rapay, and the staff here working with the community. We've come back with an alternative that we think can address those zoning issues and allow for the generational uses to continue to occur out there. So with that, I'm going to hand it over to John.
Thank you, Director Kwong. Good morning, Chair Patty and Supervisors. This is a zone reclassification application to reclassify 50 parcels totaling 148.13 acres from RL Low Density Residential to AU 20, Agricultural Urban Reserve 20-acre minimum, for animal raising general uses. The animal raising general use types includes, but is not limited to, the raising of horses, cattle, pigs, and chickens with limitations based on parcel size. The project area is located along Carpenter Road, Clark Drive, and Marfagoa Drive on the east side of North State Route 99 East Frontage Road, east of Stockton. The project has a general plan designation of RL, Low Density Residential, and a zoning designation of RL, Low Density Residential. This is a land use map showing the parcels involved in the request and the 50 parcels that will be currently, or approved by your board, rezoned to AU 20. Background. On June 11, 2019, the Board of Supervisors considered a request from Supervisor Villapudua to allow for animal raising on specific parcels with low-density residential zoning. This request to consider this action was brought forward because several owners in the area contacted Supervisor Supervisor Villapudua regarding code enforcement action. For raising horses, cattle, pigs, sheep, goats, and chickens, which is currently not permitted in the RL zone. The parcels in this area are large enough in size compared to other RL areas in the county, and many parcels have remained in the same ownership since the 1950s or before. At that hearing, the Board of Supervisors directed staff to suspend any pending enforcement actions on parcels in the area and not initiate any new enforcement actions on these parcels for the raising and keeping of animals. Also, the board directed staff to evaluate other alternatives and options that would allow for the owners of these parcels to continue raising animals. To address this issue and allow for the property owners of this area to continue to graze and raise animals, the Community Development Department initiated the zone reclassification application to change the zoning of several parcels in this area. Public outreach. On September 21st, 2019, CDD conducted a community workshop in the neighborhood to discuss with interested property owners and residences the potential to rezone their properties to allow for animal grazing, raising, and permitted agricultural uses. This meeting proved to be successful as several property owners expressed an interest to rezone their property from residential to agriculture. Upon conclusion of the meeting, the Community Development Department staff evaluated the responses and feedback received from the owners interested in rezoning the properties. On October 21st, 2019, as a follow-up to the prior community meeting, staff initiated a neighborhood referral to the local property owners to generate a list of people who will be interested in a county-initiated rezone of their property. This follow-up initiative by CDD staff also proved to be successful, as more than 50% of the people notified expressed interest in the process to allow for keeping and raising animals on their property. Over the next several months following this initiative, CDD staff created a project rezoning map and prepared an application referral. On March 20th, 2020, an application referral and proposed rezoning map was sent to responsible agencies and all property owners within the area. No letters of opposition to the project were received by staff, and no environmental concerns were raised by the agencies. CDD staff has been in contact with several of the property owners and Supervisor Villapudua's office throughout this application process. However, because of the COVID-19 pandemic and associated county responses to the pandemic, emergency stay-at-home orders, etc., this delayed the scheduling the item for Planning Commission. Basis for zone reclassification. Development Title Section 9-812.4 states that prior to approving the application for a zone reclassification, the Planning Commission and the Board of Supervisors shall determine that all the following are true. The proposed zone is consistent with the general plan, any applicable master plan, and applicable specific plan. In response to proposed change to AU20, zoning allows for animal raising general use types, farming, and crop production. The proposed parcel changes are consistent with the 2035 general plan policies for small-scale agricultural uses. The proposed zone district is reasonable and beneficial at the time. The parcels are large enough to sustain agricultural uses, and many adjacent properties already have existing agricultural operations and associated support uses permitted in the AU20 zone. These next few slides depict animal raising activities in the community that as consistent with the AU20 zoning. So there's several goats in this picture. I like that picture. Horse raising and chickens. The chickens are hiding in the coop back there. Recommendation. It is recommended that the Board of Supervisors approve zone reclassification number PA-1900157 based on the ability to make the required bases for zone reclassification. Thank you, Chair Patty and Supervisors. This concludes staff's presentation.
Thank you, Mr. Funderburg. Any questions from the board? Starting from my right, District 2 Representative Kathy Miller.
No, thank you.
Vice Chair Wynn.
Based on the outreach, I'm assuming that those residents who, I don't want to say opposed because there were no opposition letters, that that overall that there won't be a change in the neighborhood, so to speak, because these animals raising have existed for decades, I assume, generations maybe.
Through the chair, that's correct, Supervisor Wynn. Since the 1950s, a lot of these parcels have existed with animals and animal raising activities and goats and chicken and horses.
Well, I appreciate the efforts made by community development and reaching out to the community. And I know that we're currently working on another situation, which I hope will be just as successful, and making sure that the neighbors have some input in regards to any rezoning that would occur. So obviously a great job. It's unfortunate that COVID delayed the process so long, but I'm assuming things went on as always, so it wasn't really a big difference. So thank you.
Supervisor Villapudua.
Yes, thank you. Thank you, Chair. Well, I just want to thank Director Kwong and your staff. You guys worked really hard on this for the last couple of years. I remember it was like yesterday we had a community engagement out there with the barbecue, and they're really nice people and they're deserving. They've had, goats, chickens, horses for a long time, and they're always getting code violations, and I felt bad for them. I grew up on a farm, and and if we weren't able to have chickens and horses and stuff, it'd be tragic. So I want to thank you for all your hard work, and hopefully this goes through.
Supervisor Rickman.
Thank you, Chair. No, I agree. It's consistent with the general plan, and the land is maintained for agricultural uses. So, I think it's great. I think it's a great job from Supervisor Villapudua for fighting for his constituents. I'm kind of partial, being raised on, grandparents had a dairy, had horses, and so on. So, I like it.
I do have a quick question. Having traveled and lived in areas where there's farms, chickens, roosters do not crow at first dawn. They'll crow 1 o'clock at night, 2 o'clock in the morning, midnight, 2 o'clock, 3 o'clock in the morning, waking people up. Was there any complaint or any concern as it related to the neighbors that this might occur if this was approved?
No, none at all.
Okay. Great. I know we have public comment. I'm not sure if anybody's written in or if there's any anonymous attacks on this one, but we have Mr. John Bluford available to come forward and speak.
Good morning, Board. I didn't expect to have to come here. That's why I just came to work. I am glad that it sounds like this board is going to approve this redistricting, rezoning. I bought my home because of where it is. Like, people ride horses down our street. My sons wouldn't know what a horse looked like if they didn't see him every day riding down the street. We have plans to get our own chickens, and we hope to get like a cow in the future. And yes, I don't have much to say because of the overwhelming work this board has already done. So thank you very much.
Thanks to Supervisor Villapudua, I think we have a slam dunk here. Thank you for coming in, though. All right, bringing it back to the board. Any final questions? Madam Clerk, was there anybody that sent in any?
Chairman Patty, we did receive one written public comment, but I believe it was submitted by Mr. John Bluford, who spoke here today in person.
Okay, great. Then we'll be looking for a motion.
Yeah, before I make the motion, I'd like to recognize my Chief of Staff, Chris Rapay, for all his hard work. He went out there multiple times and met with every individual on that street, I believe. So thank you, Chris. And with that being said, I'd like to make a motion to approve this item.
I'll second.
I have a first and a second. Please vote.
Do we need to formally close the public hearing before the vote?
Let's ask County Council.
Yes.
Okay, we're officially closing the public hearing. Thank you. Thank you, District 2 Representative Kathy Miller. Appreciate that. This has been adopted 5-0. Thank you.
Thank you, Chair Patty, Supervisor.
I just have a quick question for Supervisor Villapudua. Did you say you had a barbecue out there the other day?
We did. Yep.
Did any of the resident animals participate?
Oh, I don't think so.
Okay, just a question.
I'm going to go out of order here. I've got, because of the time constraint, I've got a discussion item under general government, receive a presentation from from Supervisor Villapudua I put on this agenda. Let me turn it over to you, Supervisor Villapudua.
Okay, well, good. Well, just in short, I met this company, NG Services, and they do a bunch of different things: energy efficiency, battery storage, solar energy, water conservation, and with public entities. They're one of the largest energy services in the state of California as far as engineers, and they work with 13 counties in the state of California. And I believe that's one of the most. They do a great job, and I thought it'd be great for this board to hear their presentation. Ashu, would you like to come up and say a few words?
Actually, before Mr. Ashu comes down, I'd love to have Marcia Cunningham come down, Director Cunningham. Maybe give us a historical. We have an update here. I know that probably a couple of years ago now, you and I had met, and we had discussed the benefits of energy saving. There was tax credits. There were, as we know, energy prices going up. And I believe you've engaged in the past with this, the representatives from NG, perhaps. What's the status? Where are we with that whole inquiry that we had? Because again, energy prices going up. We've got some concerns on energy availability in the very near future with the water reservoirs and the hydroelectric power generating plants being shut down altogether. So this seems very timely and perhaps even urgent for us to be doing some measurable actions here. Can you give us a little kind of global view here? Not me.
Good afternoon, Chair, board members, council, CAO. Marcia Cunningham, Director of General Service. And you're absolutely correct. It's been about a year and a half. We did a request for information and had a scope of work developed on that where we asked for proposals from whoever wanted to respond. That was like right before COVID, and then COVID hit. So our current initiative is we are working with a firm that will set up and do an assessment on our utilities to ensure that we're not paying tariffs or other fees that as a government organization we don't have to do. So we are moving forward from that perspective, but it'd be nice to hear what NG has to say. They were one of our responding people with the RFI, so I'm familiar with them, and it's a world that constantly changes and something we should continue to always take a look at.
Great, thank you. Mr. Ashu, if you would please.
Thank you, Mr. Chair Patty, members of the board, staff. My name is Ashu Jain. I'm a senior manager with NG Services, and I'd like to take a few minutes of your time and take you through the presentation. I did not realize that I brought the presentation on a flash drive. I did not realize that it cannot be projected. So you'll just have to look at the presentation.
We can't do flash drives?
I apologize, Chairman, without being able to screen it for security purposes. I've talked to our ISD department in the past, and they do not recommend that we accept outside flash drives into our network system. We don't have a way to protect it from the rest of the computer system.
Thank you.
Thank you. I'm going to turn to slide 3. So I want to talk to you a little bit about who we are, and I guess I forgot. I have with me my colleague, Amelia Cottrell, so I do want to introduce her. So NG is one of the largest companies in the world, the largest energy services company in the world, the largest independent producer of electricity in the world, 177,000 employees, 70 countries, very well financially established. It's been around for 185 years. And there is a reason I'm citing all these statistics. The reason is in our business, we guarantee savings for 20 years or more, and you want to make certain that you're working with a company that, has a track record and will continue to be around. As you know, there are many companies, especially solar companies, that have come and gone, and you can rest assured that with a history of 185 years. We'll be around for a long time. In the U.S., we are, around 6,000 employees. We've been here for 46 years. We were actually part of Chevron at one time, and then a few years ago, Chevron decided to get out of the renewable energy efficiency business, and now ENGIE owns us. We do a lot of work for California counties. We only work for public entities. That's all we do. We don't do anything else, no commercial, residential, industrial. We have 8 offices in California. The closest one is in Sacramento. We are by far the largest energy services company in the state doing these projects in terms of number of employees in California, number of engineers in California. And as you'll see, we have done more projects for California counties than any other company. On slide 4, as you can see, we have done a tremendous amount of work with California counties. And also what I like to highlight is that, we've done multiple phases of work, 3 phases, 4 phases, and what that implies is that we do good work and we get called back. Tulare County, we're going in a couple of weeks for our 3rd project there, for $10 million. Next slide, I'm going to just quickly take you through some of our project examples, and I chose Central Valley. So Kings County, we've done 4 phases of work in the last 20 years, starting from, simple things like lighting and cogeneration. Well, cogeneration is not that simple, but we did cogeneration. We replaced their entire central plant, 1,000 tons of cooling. We have done solar there, battery storage. So it's, for a small county like that, we've done around $30-35 million worth of work. And we guarantee savings for all our projects. So anytime, the savings fall short of what we guarantee, we actually write a check to the entity. All 4 phases at Kings County were done sole source, no RFP, no RFQ. It was completely sole source, and that is a practice in our industry. Madera County, 3 phases, again solar, air conditioning, lighting. We're in the middle of construction of the 3 phases. Again, sole source, no RFP, no RFQ ever done. Merced County, $12 million project. We replaced all the air conditioning equipment for all the jails, all the older buildings, solar, LED lighting in every building. Again, absolutely sole source, no RFP, no RFQ. Sacramento County did this project a long time ago. $6 million project, just air conditioning and lighting, sole source, no RFP, no RFQ. Tulare County, we've done 2 phases. The last phase that we just completed was a $30 million project. We've done so many different kind of projects there. Again, all the phases, including the one going to the board in 2 weeks, was done sole source, no RFP, no RFQ. In the board agenda item, it said solar company. We're much more than a solar company. When we started as an air conditioning and lighting company, and we still have, literally 80 engineers who can deal with any infrastructure, mechanical or electrical infrastructure item you have, at the county. So we are much more than a solar company, though of course we do, we've done over 350 megawatts of solar for public entities in California. We are the largest independent installer of battery storage in California. So as you'll see in the slide 10, we do much more than
If you could wait just a moment, I'm going to have you use one of our handheld mics because that microphone appears to be creating the static.
While we're hesitating, can I make a note that we maybe upgrade or change that microphone? We've had multiple meetings where we seem to have a problem with that microphone. Would that be correct?
It does appear so. I will work with ISD to have it checked out.
Thank you.
Thank you. So I do want to talk about, the county's previous efforts. I'm on slide 11 in pursuing a sort of a comprehensive energy project. In 2011, we responded to an RFQ for the buildings that I mentioned, around 6 to 7 major county buildings. We worked 4 months on doing a feasibility study. 9 companies responded. 4 were selected for, 9 companies responded. We were graded the highest out of the 9 companies. I actually forgot I have the scoring sheet which the county provided me, and I left it in the car by mistake. But, we scored the highest out of all the 9 companies. We had interviews subsequent to that, and nothing happened after that. There was no action that resulted from that. Next, I have on slide 12. Ms. Cunningham mentioned the RFI on September, just now, and yes, there was an RFI, and we responded, and we made a response. There were clarification questions. Interviews were held on March 26th, and no action resulted from that because, of course, because COVID happened. I also want to just briefly talk about, our efforts at this county over the last 20 years. We did a proposal for San Joaquin General Hospital in 2011, for the Metropolitan Stockton Airport in 2015, did a proposal for Public Works Department in 2017. None of these proposals, as far as I know, resulted in any project for anyone. And I've personally made presentations to and proposals starting in the late 90s to when Manuel Lopez was the Public Works Director, to Craig Ogata, who was the General Services Director, to Gabe Karam, to Stephanie James, the Chief Probation Officer, Sheriff Moore, David Culbertson. So the reason I keep coming back here is I know there's a tremendous opportunity for energy conservation and energy savings in this county. I know that for a fact, that you can save a lot of money, and maybe it's a bucket list thing for me now, but I'm just kidding about that. I keep coming back here because there is a tremendous opportunity here, and I would love to, have the county, move forward with a comprehensive look at an energy efficiency, water conservation, battery storage, solar project. And as Chairman Patty mentioned, all the incentives are going down. Actually, the value of solar energy for the county, PG&E has been very successful in lobbying PUC to reduce the benefit of solar. And we fully expect that by end of this year, and I know there's no project that's going to be completed by the end of this year at the county, I'm not proposing that, the value of solar is going to go down a lot. So it is going to make solar much less attractive. So things are, there is a lot of opportunity, and more delay means more lost savings for the county. I'm on slide 14, and I'm going to end in 2 or 3 minutes here. We offer a competitive procurement process. We will bid the project out, and, we have a completely transparent pricing process. We'll share with staff all our pricing. We'll show staff how much money we're making on top. That's what we do with all the counties. And so staff is aware that, and they can choose whatever vendor or subcontractor they want to go with. We work with local contractors. We worked with Collins Electric in the past. And we pay prevailing wages. And all this is done. Every project that I mentioned here has been done using Government Code 4217, which the county has used in the past. It's not a new code for the county. So what we are offering is, and the reason this process works and why counties or any public entity chooses to go with sole source is just the fact that these are not mission critical projects. You can function as you are without doing this project. Staff, I don't know any county who has staff to allocate time to do these projects. So, it just happens that this keeps getting delayed because it's not mission critical. The other way to do it is hire an engineer, have them survey everything, do design, bid, build, which means hire an engineer to do design specs and bid it out. That'll cost you $2 or $3 million to do something like that. No county I know is willing to invest that kind of money on energy efficiency. My last slide, here's our proposal to you, slide 15. We'll do a feasibility study at no cost to the county. And if you like the feasibility study, we'll do it for a group of buildings on a rolling basis. If you like the feasibility study, we'll enter into a contract for what we call a development agreement. Usually, we charge for the development agreement because it'll take us 4 to 6 months to develop a project. And developing a project for us means, doing all the 30% engineering, coming back with guaranteed savings, guaranteed maximum price. There are no change orders in our business. And you can call the counties I mentioned to talk about that. So we will do all that work. And my proposal to you is, if you select us as a partner, we will do that at our cost completely. If you decide to walk away anytime, you don't owe us a dime. Even after the feasibility study, as well as program development, which will take another 4 to 6 months, we'll spend hundreds of thousands of dollars on that. And my proposal is that if you select us as a partner, we will not charge you anything. You can walk away anytime, because I'm so convinced that there's a great opportunity at the county, and ultimately you will go for a project. And then, of course, if you approve the contract, we implement the project using as many local subcontractors as we can find. We do everything in-house except the actual labor. So with that, that's the end of my presentation. I'll be happy to take any questions or if there are any.
Thank you very much. Appreciate that. Starting from my right, District 2 Representative Kathy Miller. Do you have any questions or comments?
No, thank you for the presentation.
Vice Chair Wynn.
Well, to be honest, I'm a little bit disappointed because I was hoping that based upon the presentation that we would get some specifics in regards to how we would benefit from these type of projects. From my vantage point, I appreciate certainly the background and your partnering with other counties, but I know our Public Works Director has been involved in some of these projects for the county, partnering with other agencies or other companies. But anyway, but I certainly appreciate you sharing with us certainly the opportunity for these type of projects to be implemented, although it doesn't appear based upon previous discussions with the county that it's borne any fruit, but
no cost. So that will determine what the opportunity is. So that is the first step that we'll undertake if you decide to work with us.
Okay, thank you.
Thank you.
Yeah, understandably, you can't shoot in the dark and overpromise and underdeliver. So I personally am in favor of this. I think we've spent a lot of time. We've got tax credits have diminished. We have an unreliable in often many capacities, the predictions that energy sources are going to be less available because of the dropping water reservoirs and the hydroelectricity. We've sat on this 2 years ago. We engaged in the RFI. For me, I see nothing to lose going forward and receiving a proposal. So I'd like to hear what the rest of the board says. Supervisor Villapudua?
Yeah, that's the reason I asked them to come. I see nothing but positives. I don't see any negatives. And I thought that why not get an opportunity to help this county out and save some energy and save some money. So the whole reason we invited him here, and give Supervisor Rickman an opportunity to speak on it.
Well, I'm the chairman. I'll call on him.
Okay.
District 5 Representative Robert Rickman. What say you?
Thank you, Supervisor Villapudua. I'm just joking with the chair. Thank you, sir. I'm kind of familiar with a little bit of this, dealing with my other former life as mayor and council member and with feasibility studies, and they did bore fruit, going through and see exactly what can be done. So, I'm all for that. And it seems like, at least the school districts that I'm aware of, that a lot of them in my district, they have so much more energy savings than the counties or the cities. It seems like they're always a step ahead. And so, no, I agree. I think it's something that we need to look at, something we should push forward. And it may cost us here in the beginning, but the savings down the road makes up for at least what I've, based on my experience. So there you go. And thank you very much for being here today.
Thank you.
Madam Clerk, do we have any comments that have been submitted?
No, we do not, Chairman.
Okay. Any public comments for our audience? Yes, Director Cunningham. You're not public comment, you're staff.
I know. So
you have no 3-minute limit.
a couple of things I want to point out is some of the things that were mentioned, we are doing LED. As we build new buildings, of course, our buildings are quite dated, so we are putting in the most energy efficient that we can get. We have a number of water projects that are coming forward that will save water. I'm going to be real honest here. When we did our assessment, one of the things that we found out from talking to other counties was that every vendor we worked with said that they would come in and do this free assessment, no charge. When a county did not sign up, I can remember one of them got a bill for $250,000. Part of our request of our RFI was we asked every single vendor, would they sign that they would not charge us anything, and not a single one of the vendors would sign. So I would think we want to be very cautious with that. Plus, we had 3 vendors that were our highest scoring vendors. So maybe we could take a holistic look back from what we did with our work. And I heard what Supervisor Wynn said. Are we going to look at solar? Are we going to look at water? We can go in many directions. Are we going to replace dated equipment? I think we need to look at that. We have another initiative that we have in process, so we are doing things. But I would ask that we take a holistic view at this.
Chair.
Sorry.
Yes, District 2 Representative Kathy Miller.
Thank you. Since this is not agendized for action today, it's agendized to receive a presentation. What I would suggest is to piggyback on what our General Services Director is recommending, that we go back and we look at the work that was done, and we have our staff come back and perhaps with a recommendation based on their review, and then it can be properly agendized for actual action. I'm not prepared today, certainly, to move forward with a sole source relationship on the basis of this, just a presentation, without our staff's analysis. And I'm always hesitant with public dollars with any sort of lack of process. And I appreciate that you've participated in the past, but so have a whole lot of other people, and that's just part of operating a business and looking for additional relationships and contracts and work. So they don't always result in projects, and so I would definitely want to see our staff, including our county administrator. I think we need to look carefully before we enter into any kind of a sole source for any hidden contractual issues. That's just a standard part of negotiating contracts, and that hasn't been done. So I would like to see this come back to us, agendized for some type of action after our staff, including our Public Works Director, has an opportunity to really look at the existing program, the existing projects, what we analyzed in 2017, and how we might best proceed.
Chairman Patty, could I respond to
Yes, sir.
Cunningham? So when I'm standing here, in an open forum where I'm being recorded, and I say that there will be no cost to the county for any of the program development, I'm on record here. So I just want to make clear, when I say there is no cost, there will be no cost. It will be a contract which will say that there will be no cost. We just sold on August 4th to West County Wastewater District a $63 million project. It's on their board on August 4th, a $63 million project which we developed completely at our risk. The board that day could have walked away without paying us a dime, and our cost in developing that project was well north of $1 million. So we are a big company. We are willing to, where we think the opportunity is good. I don't offer this to every county. Where I think the opportunity is great, we're willing to sign a contract which says you can walk away anytime and not pay us a dime until you sign the contract for implementation.
Thank you. A question for County Council. Could we, I know that as District 2 Representative Kathy Miller pointed out, that we have not put this on as an actionable, it's a discussion. Could we, though, as a board, move forward with a feasibility study, which is not going to cost us anything, but it allows this NG company to take a dive and put together their program development and bring it back to this board. So County Council, could we request a feasibility study, which would take a couple months?
The action following approval action following board approval states, following discussion, upon any approvals by the board, direct staff accordingly. I think that within that line, that you can direct staff to engage with Mr. Jain to gather more information. I don't think that it's there within that to authorize the feasibility study at this point. If it had been agendized, and the reason for that is that had it been agendized to make an approval, you might have seen other similar companies showing up and wanting to speak on the matter and offer their services as well. Mm-hmm.
But we could direct staff to work with NG.
To gather the information, to bring it back to the board and to agendize it so it's clear the intended action of the board, and that it's clear to the public the action that the board is contemplating, so that anybody who wants to participate has that opportunity.
Right. So if we were to engage, Mr. Jain, if we were to engage with NG, directed through staff, as County Council has just pointed out, would you be able to put together your feasibility study, which just gives you an analytical tool to talk, as Supervisor and Vice Chair Wynn points out, like, what is the proposal? We don't know yet, because you have to look under the hood to understand what you're going to be dealing with. Is that the parameters that we could work with your company, or do we need to re-agendize this and get maybe a more formal agreement?
I'm okay with doing a feasibility study, and we'll work with your general services as well as maybe public works staff, and do a feasibility study for a group of buildings, and come back to the board and put some substance behind what the potential opportunity could be, as Supervisor Wynn said.
Okay. So what type of motion do we need for something like that to be considered, County Council? Or are we just directing staff?
Well, I guess I would have a question about what the feasibility study that Mr. Jain would be conducting, what the scope of that is. Is that the feasibility study that is contemplated in here as the phase one that takes 2 months? Is that what we're talking about? or is that some preliminary discussions with General Services staff so that General Services can come back to bring their information to the board and get clear direction from the board on moving forward?
How would we best proceed so that you could come back with some analysis on what we could or would be able to do here in the county that would be meaningful enough for us to engage in whatever process we do after that?
Well, what I was mentioning was the phase one, as County Council pointed out. So I was offering to do the phase one, which is the feasibility study. It wasn't just a discussion with General Services staff, which I'll be happy to do, but it won't determine the potential opportunity. So if you want to determine the potential opportunity, we'll have to do a feasibility study, which we'll be happy to do without any agreement, without any cost. If you would rather agendize this item again and have another, talk to staff and come back, I mean, that's fine too. I'll leave it to the board.
Director Cunningham, question for you. Under the feasibility study, the NG proposal would be to perform preliminary technical and utility analysis, 1 day of preliminary site walk, and then present findings and savings and the scope to county staff. That seem reasonable to spend a little bit of time, have them take a look, and if it would normally cost the couple $100,000 plus that all the other companies were saying, and Mr. Jane has represented that they were willing to do this for free at this point, just to get a good understanding of what is or isn't in play. You've already mentioned some things that are already in motion, that some programs and some action and activity.
So we had specific things that we were looking for in our scope of work. I would ask that we work together, that we include some of those items and know specifically. Is he going to look at infrastructure? Are we going to look at water at the sites? Certain sites we know we have LEDs. So some of those things, I think it's going to require some interactions between both of us.
Are you available to do this?
I will make myself available to do it.
Outstanding. Okay.
Chair?
I know it's been a priority and something that we said that we would begin to go back to and address. The other thing I think that would be real important is for us to get a return on investment. And there were other vendors that scored quite well with us. We may want to have them be able to provide the same opportunity and fairness, because we did say that we would come back to them. So I think if we have the same scope of work and, they would have to do the same thing that NG's saying, they'd have to guarantee us we're not going to get charged anything if they do that feasibility study. Okay.
District 2 Representative Kathy Miller.
Thank you. Follow-up question was going to be along these same lines. I would very much want to see our other top scoring, because I don't know if NG was the top scoring or where they were in the scoring, but I would definitely want to revisit that to make sure. And if for no other reason, then this is not, as we said, these are not mission critical projects. I think I personally would have a very hard time justifying a sole source contract with a vendor when there is not any kind of pressing or emergency need for that, without going back to the vendors that did participate in the RFI in good faith. I would want to see, so that we know we're comparing apples to apples.
Vice Chair Wynn.
Well, to be honest with you, I have a problem with this whole process. First of all, I appreciate Jane, explaining, from a historical standpoint, certainly what your company can provide. And I don't understand, because this isn't a critical situation that we have to do tomorrow, why there's such an urgency. And the question would be, one of the questions would be, would you do the feasibility study and then allow us to put out an RFP for other companies to actually provide the services or the projects that you came up with in your feasibility study?
Thank you, Supervisor Nguyen. Let me answer that question. So the reason California Government Code Section 4217 was enacted in the 80s was because public entities, when it was done by the legislature to incentivize public entity to go sole source, to incentivize these projects. The reason these projects were not happening is because they don't lend themselves to an RFP very easily. If you want to do an RFP, like I mentioned, hire a consulting engineer, have him visit every building, come up with a scope of work, come up with drawings, bid it out. There's nothing wrong with that process, except it's going to cost you a few $1 million to put that effort out. So what companies did, they said, we'll ask 3 companies to do a feasibility study. And then we'll select the best feasibility study. And this is going back to the 80s and 90s, and I've been doing this for 30 years. And what companies did, because there was no guarantee on the feasibility study, I can give you a feasibility study, but I'm not standing behind those numbers. That comes in the second stage, the program development agreement. So what companies did, they exaggerated the savings, they underestimated the cost. Once they were selected, it took 6 months to develop the proposal. They came up with the final numbers. They were worse. But the county already, or the public entity already invested 6 months. The numbers were still good enough. And they said, well, we'll just go with this. You know, we already invested so much time. So that was the reason that this legislation was enacted back in the 80s. And it's the same thing happening here. I've been trying for 20 years. You know, these projects don't get done. And yes, I said it is not mission critical, but you could have saved millions of dollars starting 15 years ago. So there is a lost opportunity of savings here. I can do a feasibility study. I'm very confident that you want to have another company do a feasibility study along with us. You'll see that we are more creative. We come back with a better product. But here's the thing. It's very difficult to have 2 companies do a feasibility study where each company's information is kept totally confidential, because, we're meeting with staff, we're meeting with, your maintenance staff. Everybody will tell each other, what the other company is looking at. So it's very difficult to do an arm's length feasibility study. So that's why no county has done that. They just go pick a company that they think is qualified and they move forward. But I'm very confident that our company is the best in the industry, especially when it comes to counties. And, whatever the board and staff decides, I'm willing to go for it.
Well, I appreciate, certainly your experiences in explaining that. But I'll be honest with you, I have a real problem with, one, having, and even working with staff, is outlining a specific group of projects that, and I know our general services and our public works, I know they will look very carefully on whether the necessity of these particular projects in a feasibility study. But I guess in spite of certainly your expertise and your experience, I just have a real problem with the process itself, because my experience has been, one, is that, and this is from a public perspective, I know that my constituents are concerned in regards to any kind of relationship that I would have with a particular company that would prohibit other companies from equal participation, because you're a business person. Obviously, your company is very well known and very large. But I also know that there are other companies who do similar projects. We have our public works. We have solar projects within the county that have been very successful. So I don't deny the positive aspect in regards to savings. I get that. And our public works director is very positive in that regard. But on the other side of it, you know, for example, just to take, not picking on you, but just to take the process that we ask a particular vendor or company to come and make a presentation, and without any details, with the promise of feasibility study, that we already start down this path, maybe by not formally approving a contract, which obviously we wouldn't do because we have no idea what it would include. And then, you know, and I'm sure this isn't going to be an inexpensive project in spite of the savings. I just have a concern that the perception of the public was that, you know, this is, and I hate to use the term capital cronyism, that basically that we're, because we're tied to one particular vendor or company, you know, with the dismissal of other companies that may be just as anxious to do what you're doing. I just think that has a wrong perception, not just for us, but certainly for you. And I know you're an honorable man and your company is obviously well established. So I just, through this whole process, am very uncomfortable with not hearing, and our general service director says we have done a process in regards to having other vendors who've shown interest in response, et cetera. But you know, something like this, and it's not just this, it's almost anything that we do. I have a real problem with going on sole source without the input of other participants, and we may not get any. There may not be anybody else who's interested in even providing a feasibility study, whatever. But I would say, you know, because I'm just a layperson. I mean, I sit in this chair, but I rely on staff to make those recommendations because they're the experts. They know what's out there, that they know what the needs are, especially in an area like this. So I'm just really uncomfortable with going down this path, because what we're saying, or what I hear saying from the rest of the board, or some members of the board, is that, well, let's just start, you know, let's kind of open the door and we'll go this way with the feasibility study, which obviously I'm sure your company wouldn't be willing to spend millions of dollars you're talking about and then walk away and we hire somebody else to actually finish the project. So by virtue of taking this first step, what I see the board doing is we're headed down this path without any vetting, without any comparative, you know, bids, those types of things. I just have a real problem with this whole process, and I would rely on our general services, maybe our public works, certainly our purchasing director, you know, for those people who deal with this all the time, to really look at this from the county standpoint and then reach out to you or your company and other companies and see what you would offer in regards to providing, as you say, those savings, which I know are real. So again, it's nothing against you or your company, but just the process itself makes me very uncomfortable to really try to rush this through when there's no need to rush this process through today or next month or the month after. So anyway, I'll turn that back to the chair. Thank you.
Thank you, Vice Chair Wynn. I'm comfortable going forward, and I'll tell you why. We've sat on this for 2 years. We haven't done a single thing. And this isn't going to cost anything. We're not entering into a contract. Your company is offering to talk to our staff, take an analysis, work with Public Works, General Services, and bring back to the board an opportunity for us to make a decision. I don't see any rush. We've been doing it 2 years. We may have paralysis by analysis. We can kick this down the road further and further and further. I'd prefer they're taking action. I'd rather see us look at something by an expert in the field, so that we have a baseline of addressing exactly what Supervisor Wynn started with when he asked, like, what's in the proposal? What's going to happen? What are we going to do? What are you offering? So I think it'd be great to look under the hood. If you want to put out more requests to other people, you want to contact other people from the RFI, so be it. What's wrong with having NG engage with some analysis here in the county? It's not going to cost anybody anything. It's not going to cause cancer. It's not going to be a breakdown of our system of government. It's simply engaging with a company representative and whomever comes out in the field and does the field inspections, and come back to us in a couple of months with some information. In the meantime, if General Services wants to re-engage with other people, so be it. I'm very comfortable directing staff to work with NG. I don't see a rush in it. We're not signing anything. There's no rush to do it by a certain point. Let's just engage and move the ball forward. 2 years ago in September, and you and I talked about it a couple months prior to that. So we are literally 2 years down the road and nothing's happened. How many millions did we lose? 1 million, 2 million, 12 million? I don't know. Why don't we try to save? Our responsibility is to save our taxpayers dollars, and these are real dollar savings. It's guaranteed. Let's take a look. Other companies want to do the same? So be it. Supervisor Villapudua.
I totally agree with Supervisor Patty. This gentleman is not offering us a free quote. He's not telling us we need to do anything immediately. He's telling us he's been here for 20 years. I know 2 years ago he came and spoke to you. Just offering us a quote. I mean, there's no pressure. He's not charged us anything. So I don't see the dilemma here. I mean, I used to be in sales, and I don't see why it's such a hassle just to get a quote. The guy is offering his services, and he's not asking for any upfront money. He's not asking for any offers a contract with zero obligation. So I don't see what the big deal is, truthfully.
We're not voting on anything. We're just taking a consensus. So I'm in favor of working with staff. I see no downside to it. We're not rushing. There's nothing going to be signed next week. Supervisor Rickman, are you comfortable with staff engaging with NG and whomever else?
Yeah, that's fine. I'm still trying to figure why this even before the board. I mean, if you want, you guys can just talk. So, I mean, I guess we can direct, but it seems like this could have been done without our intervention. But I don't have a problem with that. So.
That seems to be the mystery, is why we haven't done anything yet 2 years later. And I know that we have a COVID situation and other priorities. I'm not negating the fact that everybody's got other things on their plate, but saving somewhat what could be millions of dollars or hundreds of thousands of dollars a year, I don't know, but let's let the NG company take a look and see what they can find. You've already agreed that would be something you could facilitate?
I'm fine with that as long as we include our top 3 scorers.
Go ahead. Yeah, it's fine. Public Works, you're available?
I'm always available. I just wanted to make one quick correction, right? He brought in Mr. Jain, lineage of my predecessors of public works directors that he came and approached and nothing was done. And I just want to make sure that, the board knows that, we have solar installation in the public works building that was done by my predecessor, Tom Gao, and Tom Flynn initiated the solar in the other areas, and we have solar farms in the Foothill landfill. And we also initiated sole source, so to speak. We didn't even give a contract, actually, an unsolicited proposal from Honeywell that did all the research, and your board approved the inter-fund transfer loan for streetlight, purchasing opportunity. So
that sole source. What? Oh, wait, hang on.
No, we didn't even get any money for it. Actually, we didn't even enter any contract. Actually, we didn't even give them any funding or anything. They just came in unsolicited. They did their research, and then they presented to us, and we kind of profited from that thing, actually. So we have been doing a lot of stuff in there. So I just wanted to make sure that, maybe I misheard Mr. Jain saying that he has been talking from the days of Mr. Lopez and subsequent public works directors. We have been doing a lot of work that is benefiting us, actually. And I think public works is, as far as it is concerned, we looked at everything in the public works arena, but the buildings side, I think we can have work with Ms. Cunningham.
Yeah.
Let's take a look.
And we do have sun solar, in addition to not just doing a feasibility, because we have a significant amount of buildings that need to be rebuilt. I'd also like to understand probably the return on investment. If we're building a new building, why not put solar in it right out the door?
Absolutely. Great ideas. Let's work with NG and see what they can offer. I mean, they're experts in their field, and it's not an expertise for me, and bring back to the board options for us to consider. I'm fine with it.
Mr. Chair, I just have one request. If you're going to request the top 3, and I hope we're one of them, I don't really know that, I would request that when you ask all 3 to do a feasibility study, keep it at arm's length. So let the best man come out. You cannot dictate a scope of work in a process like this. It just doesn't work. So let the three companies come, do a feasibility study, give the same information to all three companies, give the same opportunity, and let them be creative and come back with the best return on investment. And then the board can make a decision who to go with. So that's just my only request, that
I think it's fair.
Equally fair to all three companies.
Yeah, I think that addresses the concerns that we've all voiced, or the interests that we have. So I'm fine if you're good with working, and good suggestion.
I'm fine with moving this forward, yes.
Thank you. Great answer. 2 years later, we can do that.
Chair Patty, real quick.
Yes, District 5 Representative Bob Rickman.
Thank you, Chair. And I just wanted to, I think you make an excellent point. We have all the CIP and the buildings coming up. We're going to do it, might as well do it while it's getting built. And it seems like other cities are doing that, and school boards or school districts are doing exactly that. New construction, they're putting green technology on that. And we talk about climate change and savings and stuff. So I think you pose an excellent idea. So thank you for that.
Fine. Okay, moving on then. Thank you. We don't need any further action on this, right?
No, I don't believe you need further action on this.
Okay, thank you. I appreciate all the concerns raised by all the supervisors are being addressed. I believe we're going to take a half-hour break for lunch and then come back with the rest of our agenda. Unless everybody wants to keep working. Keep going? Keep going? Okay. We'll keep going. We do have closed session. We'll take a break in between closed session and once we finish our agenda. So then we are stepping back to Public Works, I believe, has a presentation to consider the formation of an underground utility district in the area designated as Country Club Boulevard Underground Utility District number 34, 1st District. Mr. Balaji.
Thank you, Chairman Patty. It's just Supervisor Villapudo's day, looks like. It's just item after item coming back, right? Stuff that he initiated. Thank you for that. Mr. Chairman and members of the board, this is the date and time set for the public hearing to consider the formation of the Country Club Boulevard Underground Utility District number 34. So that's a mouthful, actually. Hopefully my colleague here will be repeating that several times. UUD, the Underground Utility District. Following a short presentation that will highlight a few key points and informational items for the board's use as it considers the formation of the recommended underground utility district, we would make the recommendation for the formation of this district itself. Accompanying me today is Mr. Michael Chung, Senior Civil Engineer in our Public Works Department. He will discuss very briefly what an underground utility district is, how they are funded, and where the proposed UUD is located, and how we chose this location, and the parties involved in completing this undergrounding work, and finally, what the benefits would be for the public in doing this, and when the UUD will be anticipated to be completed should your board approve the formation of this district today. Following his presentation, we'll recommend the chair open the public hearing to receive any testimony, and then the staff will be available to answer any questions, and you close the hearing and take action on this particular item. With that, I will turn it over to Mr. Chung to go with the presentation.
Thank you, Director Balaji. Good afternoon, Chairman Patty and members of the board. An underground utility district, or UUD, is a defined area where overhead wires are relocated underground, utility poles are removed, and future wiring, if any, is also required to be installed underground. California Public Utility Commission, or CPUC, regulation required the governing body to adopt a resolution to form a UUD. In 1967, CPUC adopted an overhead conversion program known as Electric Rule 20. Under Rule 20A, a subset of Electric Rule 20, CPUC required PG&E to allocate work credit each year to community for conversion projects. Work credits are allocated to local agency each year based on the number of service connection within the community. The funding for these work credits is provided by ratepayers through utility rates collected through monthly utility bills. Utility companies are required by state regulation to collect and expend these funds specifically for conversion. Creating a UUD allowed the use of these funds. The work credit balance as of February 2021 is approximately $18 million. The estimated proposed UUD number 34 cost is $8 million. The proposed underground utility district is located along Country Club Boulevard from Franklin Avenue to Pershing Avenue. Public Works coordinated with PG&E and confirmed that the UUD location met the requirements for the Rule 20A program. Adjacent property owners were notified of the proposed UUD and frequent asked questions were made available for their reference. Comments were received and the county responded back to each of the constituents. Property owners and effective utility companies were also notified of today's public hearing to receive any additional comments. Public Works secured an active transportation program planning grant in the amount of $242,000 to develop a country club complete street and multimodal improvement plan. The Country Club Boulevard UUD would make the corridor more pedestrian and bicycle friendly, enhance appearance, and aid in achieving the objective of the complete street plan. In addition, the formation of a UUD will enhance safety by eliminating the poles that can pose collision hazards for vehicle, reduce the probability of power outages resulting in improved service reliability, provide aesthetics benefits by eliminating unsightly overhead wires, as shown in the attached photos, and allow the county to take advantage of dedicated funding set aside specifically for undergrounding purpose. Undergrounding the utilities are substantially funded through PG&E Rule 20A program and other utility company regulations. PG&E will be the lead agency managing the design and construction activities. Minor administrative costs associated with the UD will be covered with designated transportation revenues. The primary responsibility of property owner will be to provide access to their property to allow for the conversion work to be completed. Any unpermitted or unauthorized electrical connection will be the responsibility of the property owner. The public hearing for the adoption of the Country Club Boulevard UUD number 34 is today. Once the board approves the formation of the UUD, the design and construction of the undergrounding activity will take place over the next 5 years. Concurrent with PG&E design of the UUD, Public Works will finish the Country Club Boulevard Complete Street and Multimodal Improvement Plan and pursue additional grant funding to construct the identified improvements. At this time, I would like to turn it over to Director Balaji for the closing remark.
Thank you, Michael. As Mr. Chung mentioned, we're here today to have the board conduct the public hearing to receive any public testimony regarding the proposed UUD formation. At this time, we recommend Mr. Chairman open the public hearing to receive any testimony, close the public hearing once all the testimony is received, and lastly, consider the testimony received and make a finding regarding the designation of the formation of the Country Club Boulevard UUD number 34. The department is recommending the board to form this UUD number 34. And before we open the public hearing, I would like to take a moment to thank Supervisor Villapudua and his office for their leadership and tireless efforts to inspire us to get to this point, actually. As you know, any of you who have traveled that Country Club Boulevard knows how wide that road is and how pedestrian unfriendly it is. This is perfect opportunity for us to combine undergrounding these existing poles and thank the staff for their diligence in obtaining this alternative transportation planning grants, actually the ATP grants, that would study what improvements we could make to make that corridor more accessible for pedestrian, bicycle, and other alternative modes of transportation. And, in hand with this project, utilizing these underground, service credits that we have, Rule 20A credits, which would make this, project much more successful. And I know that Supervisor Villapudua and his chief of staff, we had a couple of meetings with the public. We received their input, and this all culminated as a result of that. So I want to recognize the supervisor for his leadership and his staff to get us to where we are today. Thank you.
Thank you, Director Balaji. Is there any preliminary questions from any board members?
I had a comment.
Sure.
Thank you, Chair. Well, Mr. Balaji, I just want to thank you and your team of Public Works and my Chief of Staff, Chris. This country club, a lot of work, and with this project, it's going to look a lot better, and I think the residents are going to be really happy. So thank you for your help.
Thank you, Supervisor Villapudua. This is the first step of many, and we're starting with these baby steps. Hopefully, we will identify a good plan through the ATP, and we'll also secure funding for that. So we'll be able to implement that plan once this undergrounding work goes through concurrently.
Thank you. I will declare the public hearing open. Anybody like to come forward? Pick a number, stand in line. No pushing, shoving, or running. It's downhill. Thank you. Any public comment submitted?
No, Chairman, there are no written public comments.
Okay, we will officially close the public hearing, bring it back to the board. Any final comments, questions, or action?
I'll make a motion to approve.
Second.
We have a motion and a second. We are 5-0. Thank you. Approved.
Thank you, Chairman.
Thank you.
Thank you. So then flipping back and forth on our pages, we've completed the discussion under General Government number 1. County Council, we have pulled item number 2.
Discussion item 2 has been pulled.
Thank you. That will bring us to Board of Supervisors comments and committee reports. I will start again from my right to left. District 2 Representative Kathy Miller.
Thank you. What I am hoping to bring to the board today came about from both some committee work that I've been assigned to with Supervisor Villapudua on the Women's Committee, but also discussions with County Administrator in terms of conducting a scientific and professional survey of our residents on their priorities, both so that the feedback could inform our strategic planning session coming up, but also some of the research that the Women's Committee is conducting in terms of our budget. And so at this time, I would like to turn it over to CAO Wilverding to provide some details. The context for this is when we discussed amending our board policy to for any expenditures that weren't already built into the budget, and we Supervisor Wynn brought forward the concept that really any expenditure that a supervisor was involved in generating, even if it came through the CAO or one of our department heads, it really should come back to the board. So both Mr. Wilverding and I felt that in the interest of transparency, that it would be a good thing for him to bring the details back to the board. It is well within his authority, but we still felt that we wanted to remain within the spirit of that amendment to our policy. And so I would like to turn it over to our county administrator now.
Thank you, Supervisor Miller. And members of the board, just to give a little background information on what Supervisor Miller was talking about, there was a Women's Committee meeting on July 20th this year, and as a part of that, Supervisor Miller had brought up idea or the notion of if we could get a community survey with priorities from our constituents, and it was as it related to the Women's Committee, kind of to get a tool from residents as to what their priorities are. And Supervisor Millard suggested, I guess ISD had done something like that in the past, and talking about what other resources we might have available out there to do that, and to look maybe for a broad spectrum county-wide type of survey, and finding a consultant who could write respective questions that would generate the best results that would come back to us. And some of the topics that got thrown around was about an equitable distribution of resources around the community. What are our constituents, or your constituents, I should say, thinking about what we're doing in terms of how we're spending our money? We look back at, and some of what you all approved earlier today, $33.7 million through family grants and small business grants. We've done homeless initiatives. We have, fortunately, a lot of surplus money that we've been using for one-time purposes, and we're having anecdotal evidence potentially, or information coming back to us from constituents. But if we were to do a scientific survey, what would that tell us? And so it occurred to me that, and I've been working closely with Beacon Economics on this economic recovery and development plan, and I do have a good relationship with them, and I got talking with them about it. Is this something that would even be in your wheelhouse? Might you be able to put together some sort of a cost estimate? I have no idea what something like this might run. And would you be open for doing something like that? And the answer was an astounding yes, and they got back to me pretty promptly. And so what I asked them to do, and they did it free of cost, was to provide a proposal. And that, as it turns out, they do this quite a bit with a partnership arrangement they have with a research firm called Godby Research. Apparently, Godby's been around since 1990. They do full-service public opinion. They do voter polling, market research, and they offer extensive experience in research studies to address resident satisfaction and community priorities, which is like right in the bullseye of what we were looking for. Over the 31 years the firm's been around, Godby's conducted more than 2,500 public opinion research projects to evaluate topics such as resident satisfaction and priorities, quality of life, and budget priorities, which, this is beyond it's expanding beyond what Supervisor Millard asked for the Women's Committee, and then we got thinking, well, maybe this would be relevant to our county in general. A little bit more background about Godby is they've got a lot of experience, and around our community, they've conducted voter surveys for the city of Stockton, and apparently they've worked in the past with the county of San Joaquin. I wasn't aware of that. On Measure M to support the library and the recreation services. So they do have a track record in our organization, and they do work closely with Beacon Economics that I have a relationship with and a lot of respect for. So what would that involve? And I'm just keeping it short here.
Not really.
Yeah. I have no idea what you're Don't I get 10 minutes?
I have to tell you, I have no idea what you're talking about. First, we were hearing about the changes that were made that were asked upon you. There was that baseless false narrative and lie about me approving $45,000 in the contract. So that was just brought up, that's what you've amended, and then we're hearing about a survey. I'm a little bit lost as to what we're talking about.
Okay. Let me summarize it. The issue came up about doing a survey throughout the county and what that might take relative to the Women's Committee. I had taken a look at that, and as a part of that, found out that Beacon Economics partners with Godby Research, and that not only would they do something that would satisfy that, they do things that are more countywide, and that would the couple of things that I just mentioned, as far as the survey, voter satisfaction, priorities for economic spending and all that, that sounded like it might be relevant to know, given the amount of money that we're deploying out there. Supervisor Miller had asked, is that something that we might engage these people to do? And what I had suggested is, in the spirit of what was recently discussed at the county, that we discuss this in front of the board rather than me saying, yes, ma'am, I'm going to run forward with this and we'll spend X amount of dollars in order to do this because you as one supervisor asked for it. Is that a little more clear?
Totally clear. That's okay. Yeah.
And so this is the item that Beacon brought back, and it sounds like it's something that could be pretty beneficial for the county. And so that's why I believe Supervisor Miller wanted to bring it up in board comments.
So question for you, is this something that fits within the budget that would run through your office and therefore you don't have to get our permission or approval? Or is this something that should be agendized based on the cost? I'm curious, County Council, if we're...
This is something I could clearly do on my own if I wanted to.
Got it. Okay.
And Chair, if I might clarify, a couple of the things that, as we discussed this, and we began to see that there might be some really positive information for all of us as we do strategic planning, some of the criteria for this sort of a survey that we wanted to bake into it was that there be an equal sampling from each supervisor's district, so that all of these responses aren't going to come from the city of Stockton, that we're absolutely going to do this in such a way that the data is valuable to each one of us to just get some feedback on what our constituents are interested in, what their priorities are. You know, we can't know everybody in our districts, and so this is just a tool. I'm only bringing this forward today just as an informational item to the board. The CAO clearly does have the capacity within his budget, but I thought it would be a good idea for the full board to hear about it and know that that's what's going on.
Fantastic. Thank you. County Council.
There you go.
Let's try now. To the chair, Supervisor Rickman has raised a concern, which I think is an appropriate concern. Typically, and so I just want to bring it to the board's attention, typically supervisor comments are limited to comments being made by the supervisors and not really engaging in any dialogue regarding those comments. And so I do just want to bring that back to the board so that the board can focus on those and try and keep them so that they are the supervisor's comments and there's not that dialogue which then brings risks with the Brown Act.
Understood. Thank you.
And I turned this over to CAO Wilverding. It was his request, his suggestion. He thought because he was the one that had the information on it, he could provide that input to the board. I could have easily just told you about him doing it. So if I didn't follow the protocols exactly correctly, I would apologize. But as I said, we're not looking for any direction or anything like that. This is strictly informational, and it was to flesh out my comments to the board.
Thank you. District 2 Representative Kathy Miller, I appreciate that. And in fact, we don't get together often as a board, so to talk and listen and learn and engage. So County Council, to that point, since we do have this mechanism of oversight and inclusion for something like this that would fit within the CAO's budget, what would be a different approach? Should this be agendized as a discussion item for information purposes, or just, we were fine doing what we did, but it shouldn't be a discussion, just so that we don't jeopardize, as you said, a potential Brown Act violation?
Correct. You're fine doing what occurred here, but You want to avoid the discussion because these supervisor comments are not agendized as discussion items.
Understood. Okay, thank you. District 2 Representative Kathy Miller, is there anything else to share or report?
No, thank you. I just wanted to provide that information to the board. Thank you.
Thank you. I think it's very helpful and informative and a good thing to do. Great job.
Thank you.
Vice Chair Nguyen, any comments or committee reports?
Yeah, several, but I'll just focus on one. The redistricting committee. And I ought to turn it over to Supervisor Rickman first, let him make his comments, and I can follow up. So Supervisor Rickman, if you want to just provide your insight, and then I'll follow up on the rest of it. How's that?
We're shattering all the rules here.
No, it's supervisor comments.
I'm kidding.
No, hey,
Supervisor Rickman, what do you have for us?
That's funny. Supervisor Nguyen's getting me back. But Supervisor Nguyen, the chair of the redistricting, doing a great job. And doing public outreach now, and we just got, what was that? When was the last meeting? Was it yesterday?
Yes.
Yesterday. We received a survey, and kind of like what you guys were talking about, and I'm going to mention that, and the interest of what our residents in each district, or each city, I should say, are interested in. And they numbered that. There's been some great dialogue. I believe there was over 7,000. I think there was over 7,000 folks here in San Joaquin County that filled out more than one question on the survey. And I believe we were looking at hopefully like 1,500. So it's great to see citizens engaged. Now, we're still in the process. I don't have the information in front of me, but we do have outreach coming in, I believe, next month in Tracy. And then the next one is after that. Is it Lodi?
Lodi, right.
And Lodi. So we ask our residents please get involved. This is once every 10 years, and it affects us all, and making sure our redistricting, and at least what we're doing at the state level and the congressional level, is fair and adequately represents San Joaquin County as a whole, what we would like to see. But Chair, I'm going to turn it back over to you. Oh, excuse me. Supervisor Nguyen, you're doing a great job, and keep up the great work, and I'll turn it back over to you.
Well, I have to recognize my co-leader in this is doing a great job also. And just a couple things. One of the things that I've been impressed in regards to the advisory committee is that the number of participants, organizations that have been willing to step up and advise their membership as to participate in our survey. There was about 9,700 responses, but some didn't start it. That was about 8,700 that answered at least one question, and about 7,600 that did the whole survey. One of the interesting parts, and I don't know if we sent this, and I'll ask Jelena, did all of you get a copy of this in your email? But if you didn't, we'll send it to you, which is basically a breakdown by city and the county, et cetera. An interesting phenomena was that about 35% of the responses were from out of county, which raised some concerns. But
county?
Out of county, other than San Joaquin County. And but in looking at them and comparing them, and if you see in our tables, it does have county or all responses within county. The responses from out of county were consistent within county, and the assumption was people were doing it from their workplace as opposed to from their residence, and that's fine. So, and also what was interesting is the breakdown, because I know we all have a preconceived idea of maybe the political bent towards different. There were some ranges, but for the most part, as a county, we're fairly homogenous. And I thought that was impressive. I would also say the one thing that from the very beginning, when Bob and I started this committee, and I did 2 presentations out in the public last week, but I think one of the things that we've really harped on is this is apolitical or nonpartisan. This isn't about D's and R's, period. And therefore, everything that we put out has there's 2 questions in regards to conservative and liberal, which doesn't get into the parties. And that was probably just kind of a generic type thing. But the reality is, we will stay away from the politics of it because we're really looking at the issues. And more importantly, I think one of the things that I find is developing, at least in the meetings that I've attended and made presentations, is that it's about representation. It's about San Joaquin County having representatives who speak to our issues as opposed to being fragmented, whether it be our assembly districts or certainly our congressional districts. And I think from what I hear, there's some, and especially at the redistricting commission meetings, there's been some interesting comments in regards to Contra Costa County, Stanislaus County, and Sacramento County. So these are things that we're taking into consideration. Our role as the county is simply educational. We are not pushing anybody, and we repeat time and again and provide them with materials that either as an individual, because individuals are attending meetings, or organizations like El Concedo and WCP and the Superintendent of Education, all these they're more than capable of making their own statements to the commission as to what they perceive. So we're not driving this thing. We're just providing the information on how to participate. And so the last thing that I would say that the next central, there's 11 zones within the state. The next meeting for the Central Valley is actually tomorrow in the afternoon. But more importantly, one of the things we've said is that it doesn't matter that you can voice your concerns, 3-minute time limit in any zone presentation. You don't have to be stuck with that because we've heard from the Bay Area and vice versa in those meetings. I'm very encouraged because as Bob said, I think we were looking at 12 to 1,500 minimum to be effective. 4,000 was the gold standard, and we had over 7,000. So they were very pleased. Glenn Fowler, who's one of the consultants, was very pleased in regards to the responses. So I think we're on the right path. I think eventually, as we get more input from the community, and what I've suggested to the advisory committee is that eventually, maybe, if this board would like to make a statement, a unified statement to the commission, we can do that. If that doesn't work out, we can do it individually, however it works. But at some point in time, we will have that discussion here at the board level just to inform our fellow supervisors and to get a consensus as to what we perceive as to the redistricting should look for those particular areas. Board of Equalization is part of it, but I think there's 37 counties, and that it doesn't really mean much for us. So anyway, I'm very happy for my co-leader because he's doing an outstanding job, especially in his willingness to volunteer me for a bunch of things, including the meeting tomorrow afternoon. Anyway, so I'll leave it at that, Chair. Thank you.
Thank you. And Supervisor Rickman, did you have anything else to add before Supervisor and Vice Chair Wynn called on you to speak and put you on the spot?
I just have one quick thing, but if that's okay. I did not with Supervisor Wynn. I just wanted to give a shout out to Ed Winkett here on the County Economic Development, and called him a few times about the RAD card, and I had all the answers. Been over backwards to help me out, and the program itself. I know we were talking about different funding options. So Ed, if you're watching, thank you for your help. And I just want to give a shout out to my youngest daughter, just left for Montana for school. So I hope she's having fun. We miss her. And then my oldest one is going to Sacramento for college. So we'll be empty nesters for the first time. So we'll see how that goes. So you might just show up in the morning. I'll be here. Because, but hey, just want to tell them that I love them and have fun.
Excellent. Supervisor Villalpudua.
Thank you, sir. Thank you, Chair. I just want to thank Supervisor Miller and our Chief of Staff, Camille, for the Women's Committee. You've done a great job of taking charge, and Camille also, and I think it's making a lot of progress, and just want to thank you for all your efforts.
Thank you.
All right, then that comes to me. As it was introduced over, I know that our CAO had fixed and amended and took care of the suggestion that Supervisor and Vice Chair Wynn had as it related to supervisors approving funds, and I appreciate that District 2 Representative Kathy Miller had come forward and in that spirit had some great informative information. I think it was exceptionally unfortunate that this was spawned from a false narrative and a blatant accusation that was incorrect. And of course, I never got an apology on that false narrative and lie about me. But we had a great meeting today. Appreciate working with everybody, and we are productive in spite of some of the snipping that goes on back and forth. I will close this meeting in remembrance of a young boy that was killed on Pacific Avenue, Miracle Mile. One of Miguel Villapudo's very dear friends was hit and struck by a car and nearly lost his life and has gone through numerous operations, Mr. Tony Yoakum. I also, in the same crosswalk, was struck by a car, had 4 spine surgeries. I continue to have an incredible amount of bad negative results from getting hit by a car while walking across the street. But nonetheless, I got a chance to walk away. And this young man did not. He was a promising young man. He was working at the Ave. He was loved and appreciated by not only his family, but those that he worked with. And there was a nice candlelight vigil yesterday where people in the community had a chance to speak out on his behalf. So I will close this meeting in recognition of Casey and with heartfelt condolences to his family and his friends. Thank you. Meeting is closed. County Council.
The board will meet in closed session on the items listed on the agenda. There are no announcements expected coming out of closed session.
Thank you. We'll take a 20-minute break and then go into closed session.
You